think same day or 2 days after that, I got another rejection from UJ. So UJ rejected me twice. They went the extra mile.
How?
It was nice. It was nice. I think they wanted to make sure I don't show up.
So, okay.
And I think it was on Tuesday after class. I got a call from UJ. I'm like, UJ is doing the most. Now they're calling me to tell me not to come. I'm like, and so I didn't even respond. I just picked up the call and listened. And the lady like,
so what do you want to say so that you can go?
And she was like, it's Anita. We know it's short notice. I said, I'm coming. They're like, we're wondering. I said, I am coming. She said, we will send you an email. I said, you don't need to send it. I am coming.
Said, you don't need to apologize.
I don't even know what you wanted to say. So did she get to explain why they rejected you? Now they're inviting you. She said to me, eventually when she got a chance to speak, that candidates that were invited, a few of them got taken elsewhere and some were not coming for whatever reason. And I was on the waiting list for invite. Wow. Invite. Wow. It was the Tuesday and I was expected to be there the following Monday. Wow. Thank you for watching this video. I'm excited. I've got somebody here who's very active in the field of psychology. We met in they call it the street of social media, where she has been very active and came across our channel, what we do, and decided to pursue a career in psychology. She's now selected as a clinical psychology candidate at UJ, yeah? Wow. So she's here just to share a journey about how she got into the psychology, her career background. I just want to welcome her so that she can just give us a bit of a background about herself. Anelisa, welcome. And if you can just briefly just introduce yourself, who's Anelisa and where you come from and how did you get to psychology? I think that's the most interesting part. How did you get into psychology? Over to you and welcome. Okay, thank you, Doc. Thank you. Well, who am I? I'm Anelisa, but I'm very much affectionately referred to as Lisa by a lot of my colleagues, friends. Let me use Lisa. Yes. It confused me because I know Anelisa. I'm like, oh, Lisa. Let me stick to Lisa. I like it. Yes, so I grew up in Eastern Cape, East London, and I started working in KZN. I've been in KZN since 2012. But I studied radiography, so I first pursued a diploma in radiography 2009 to 2011. And then after that, I did ComServe. We also do ComServe in radiography. So I did ComServe at Gray's Hospital in Pietermaritzburg. And I kind of stuck into KZN from there. After that, I immediately pursued a BTech in radiography, which I think I finished in 2015 because I was playing around a lot. And then so you started with the diploma. Yes, in radiography. Okay. Yes, we still had diplomas then, so I don't think they still have that anymore. So no, we don't have anymore. Not that I know of, but I know during the time of VetsTech, I once wanted to do BRED. There used to be a diploma during VetsTech time. I think I'm revealing how old I am. So VetsTech is then combined with RAW to form UJ. So yeah, I remember. Yeah, but story for another day. So yeah, I did. So you had to do a BTech to get your diploma into an equivalent of a degree.
So I did that because I thought I was going to go overseas. I had dreams. I was young. And then things kind of moved on a personal life in terms of relationships. And I got married, I had kids, and then I then decided to pursue a master's in radiography.
Wow.
Yeah, I did that. And I think the reason for doing that is probably the reason I ended up in psychology. So I'd always loved patient care. So I'd always loved patient care, the idea of patient care, and the proper patient care. I've always there's I think the extension of why I got into health had to do with patient care. So I loved patients. I loved interacting with patients, and I always felt there was a gap. There was always something missing. And especially in a radiography career, literally, if most patients are with me for 10 minutes and they're gone, and I felt it's that 10 minutes I need to be impactful. So they need to remember me in a very good light.
That's
so
great.
When I started seeing a lack of this in terms of people focusing on this, because you're seeing a patient for 10 minutes, they're like, hi, bye. It doesn't matter what impression they have. I need to have done my job. So I felt part of doing my job is making a positive impression and a contribution to a person's life. So I then went and pursued a master's on professional development. So I did one under the topic professional development, and I went all the way and actually finished it. So I did that. I finished it. I think I graduated 2022.
With your master's in BRAD?
Master's in radiography, yes, diagnostic. And then
maybe before you go there, tell me, so if you do a diploma in radiography, what are you when you complete? Are you a radiographer or are you assistant radiographer?
I'm a diagnostic radiographer.
And then, so basically anything else is just an addition?
Yes,
in
anything
terms of
else.
your studies. It doesn't change your title per se.
No, it doesn't.
So there are no assistant radiographer. Like I know in dentist, you have like, dental therapists, you've got dental assistants, but in BRAD, you don't have. Oh, okay.
They phased those out years ago. So those.
Oh, okay.
They used to be, they don't have anymore.
Okay.
So I think after I completed during the course of my master's, I'd obviously have intention of doing a PhD. And I actually engaged a potential supervisor. And I think I started, when my husband asked me, why are you've done a master's, you're clearly not looking to go into academia. Why are you doing a PhD? It adds no value to your career within the hospital. And he was right. It doesn't change. It doesn't make me more competitive on a salary. Nothing. So I then had to maybe zoom in why I kept pursuing this. And I was like, this is what I want. Then he said, are you not maybe looking for a different field within your own field? And that's when I zoomed in and said, the whole point of this was patient care. And I started remembering a lady I once met a lady at Grace Hospital when I was a ComServe. And she was a psychologist, and they were doing, these grand ward rounds they do in tertiary hospitals that we sometimes even see on TV. So they were doing that, and they were talking to the patient, and I was passing by to go do an x-ray in the ward, and everybody kept talking to the patient, addressing the patient by patient or the disease, like the pneumothorax guy, there was no given identity to the patient. And then this one lady, very well dressed as well. I think that's another reason I'm well dressed, which in hospital, it's not something that happens. I mean, doctors, radiographers, we're all in scrubs. We're in scrubs, we just there. So she was dressed with a purpose. And she was the only one who I think even knew the patient's name. So she would address the patient on a surname basis or on a first name basis. And her treatment plan involved the patient. So there was reference to Mr. Kumalo and I. Mr. Kumalo thinks this. And I was like, wow. Once she knows the patient's name, too, the patient has a say on what is being done. And I started reviewing my own patient treatment as in, I don't think I've actually involved the patient in what I'm doing. I tell you, I'm going to do a chest x-ray on you. You are going to take off your shirt and you're going to stand there. And that's about
Mm.
that. For me, there was that, or maybe within radiography, or me, there was that thing. Once you've walked in the door, you've given consent to what's going to be done. There was not extra step that we are going to do this. Are you okay with it? Do you understand it? So none of that is being done. So I then remembered that when my husband asked me about this whole studying, and I was like, no, I wanted to be this person. And then he said, then go be that person. And I was like, okay.
I like your husband. That's so practical. Go be that person.
When I tell you, by the time I finished I graduated my master's in 2022. And then in January 2023, I enrolled for non-diploma purpose modules at Unisa. And I did all 10 modules in 1 year. Also, they made me do all the psychology modules from year 1 to year 3 of psychology.
Yeah.
I did all 10 of them in 1 year. That was last year. And by July last year, I had found out about SACAP. I had engaged them. I got a provisional acceptance. And now here I am doing honors in psychology.
Wow. Now it makes sense, because you remember when I chatted with you before we started, that when I saw you on Facebook, I could see the person is very informed. For you to take up 10 modules, you must have consulted throughout for you. Wow. 10 modules.
It's 5 for 6 months and 5 for 6 months. And I've been studying all my life. It did not really like a great workload, because since I qualified, I'd been studying. I did my BTech immediately, 2012. I followed with a master's. So there was never a time I was not studying. So I've been studying and working. So I did not see that.
And you did it full time?
The term modules, Unisa is kind of part-time. It's at your own pace, at your own time. So I'm like, okay.
No, I mean, like, you're not working at the hospital anymore. Were you like at home studying? Were you working?
I was working, I was mothering, and I was wifing. All of that was
Wow. No, you are very strong. You are
everything was done 100%, but they were done.
Wow. No, that must have been hectic.
Yeah, it was nice. I enjoyed the undergrad modules a lot.
But being a mother, being a wife, working full time, studying, that's a lot.
I enjoyed it. I enjoyed that.
Wow. No, big up to psychology and enjoyable modules in psychology. I tell people psychology is joy.
Oh, it was, I could not believe, I genuinely could not believe what you've all been sitting with, the information. And, when you look at this, especially this developmental psychology, and I would look at kids and I'm like, oh, this is my child. It was like a revelation.
Wow.
It's been happening.
Wow.
That excitement of realizing things.
Wow, I like the excitement. Welcome to psychology. How does it feel that you are at this side now?
Oh, it is fantastic. I will not lie. I'm enjoying it. It's it's like seeing life in 3D. It's nice.
Wow. Now it testifies to why actually you even got selected on your first time application. I think, everybody probably when they interview you, they can see through you. The interest is there, the joy is there. The passion about psychology is there. And you have got a very interesting story of how you got into it. So probably that added more value. But obviously, we're going to get into it. For now, I want to ask you, what then informed like obviously you mentioned about the issue of the lady that you saw at the clinic, but I want to find out, you decide I want to follow psychology, but then what informed you going for clinical? How did you get to know about, there are 5 fields in psychology, there are now 6 with the neuro being added. How did you get to know? There's a counseling registered. Actually, there are 7 if I add the 2, which are non-psychologists, but they're within the board. They're registered in the psychometry. There are 6 of them. How did you decide I'm going for clinical? Why not industrial? Why not any other category in psychology?
Well, I
Did
guess
you
in the
ever
more
know that there were these different categories or?
I didn't know, but the lady, like I said, I was going to be the lady. I saw she was a clinical psychologist. She was in a hospital. So
Yeah.
I was in a hospital. And when I did start actually investigating and reading up on psychology, I could not imagine a place where I could be that's not the hospital. So
I
I'd
see.
been in hospital for what, for 12 years now or more. So that was one of the selling factors for me, that I could not leave the hospital environment. It would defeat the whole purpose of me becoming a psychologist, because it was about patient care. So how am I giving that patient care if I'm an industrial? And then in terms of, there's also the research component. So like I said, I did my master's in research in radiography, and I enjoy research. I enjoy it all my heart. I did play around with the research psychology part of it, but I just could not imagine a world where my patient is referred to as a participant. So it's patient first, participant second. So I could not go and be a research psychologist where everything is viewed as a participant and where I don't actually primarily see them as that. So I couldn't. And the nice thing about the approaches that they have now in terms of many careers is research is expected. You're expected to be active in research. Hence, it weighs so much even with a degree. So clinical psychology combined all that I like: the clinical aspect, the being in hospital, and the research part of it.
I like that. And did you ever have time to speak to this lady?
I actually did. We actually became quite good friends.
Wow, wow, wow. I'm sure when she sees you, she's so happy about the journey you've taken so far.
I hope so. I hope so.
Wow, wow. And now I want to get into you being accepted into the masters in psychology. Already you shared, you went to Unisa, you did all the 10 modules, which is very inspiring. I mean, it takes a lot. I usually say, and this is just my theory, I mean, it's not scientific, that you need to at least have a degree to make it at Unisa and, I mean, pass on a record time. I think it's just made for people who are more mature. I mean, I was shocked when I went there. I mean, I went to Unisa when I finished my degree, but I was like, how do they expect somebody from matric to survive in this kind of environment? You know, it needs you to be more independent, but more mature, understand what needs to be done. How did you experience it? Maybe just from your side.
For me, I think having studied in a traditional way, because I was a face-to-face person, and the emailing a lecturer and not getting a response was very frustrating.
Yeah.
I think I went to visit the center down here in Durban quite a few times. These computer-based things aren't for me. So I just could not grasp when I had to write my first online assessment. I went there, I had to, so I had to we walked through a lot of the steps with the technology part of it. But the engagement with the work itself, for me, I like you're saying, it takes a mature student who knows what they want. So engaging with the content for me, because I was curious, that part was nice. But the experience of Unisa, I could not imagine doing my honors there. I didn't. I was not going to survive.
Yeah, I can imagine. Yeah, look, I mean, it's obviously it works for different people, but I must say, I think that's just my observation. I think I end up doing a video where I do a distinction between distance and non-distance. I think you undermine it, but I think for somebody who has never been to face, and obviously they don't know anything different, they only know Unisa. But I think for somebody who has never had a degree at all, it adds another dynamics to it. And I mean, somebody from matric must appreciate it's not going to be simple. It's going to be very difficult. And it makes sense. I mean, Unisa has got a very high failure rate, dropout rate, and all the things. Because I mean, people who go there, majority who find that from matric and they never cope. But also even those who are working, who have got, I mean, who are married and all that, is still a lot because you need to juggle work and family and yeah, no. But I'm happy to hear that. I mean, it worked out for you. And it worked out very well because you must have had also good marks for you to make it to psychology as well.
There was a in terms of my previous marks or the marks to get into SACAP.
No, the one for your 10 modules.
For my 10 modules, yes, no. I don't think not having good marks is an option. My sponsor is very strict on if I'm investing in this, you must be investing equally. So, and the only tangible investment in an education is good marks and progress. So, it had to be done, and it had to be done properly.
You sound like your sponsor is academic, just from listening to you. But anyway, so you finish your degree at the 10 modules at Unisa, which is equivalent to psychology degree. And obviously, I assume they wanted you needed to do an honors. So where did you go then for honors, and what was the process to get into honors?
So after I think about 6 months at Unisa, when I was going to start my last 5 modules, I then had to, obviously they were opening also their applications, and I knew for a fact, based on the content I had picked up within the undergrad programs, that the engagement I need for my honors level needs to be very intense, and I couldn't do it online by myself, because whatever ideas I had about the content, I had nobody to dispute my ideas. So whatever feedback I have, I don't have anyone else's opinion. It's mine, and that's that. So I needed diversity in how much, in what I was absorbing and how I'm perceiving it. So I then looked into, I applied at NMU, where I did my previous degree. So I applied there. I applied at UKZN. And I then looked at the structure of UKZN, and I think I asked someone who went to UKZN, and they weren't very happy with the honors level at UKZN. And I don't deal with disorder or dysfunction well. I'm a person of order. If this is the line, you better toe that line. So I like things in order. So I was looking, YouTube is a YouTube, and this podcast that people have like you are very informative. So I saw a lot of your comments there, and I would see you posting an interview about this person, an interview, and I'd go look at the interview, like, this is not what I want. And eventually I got to an interview that you did of some lady who explained how she wasn't taken where, but ended up resorting to SACAP.
Yes, I remember that, yes.
Then I started Googling SACAP. I then found out about SACAP and Varsity College. I went to visit the 2 campuses. SACAP turned out to be 5 minutes drive from me.
Wow.
And Varsity College, 15 minutes drive. So I got to SACAP, and I won't lie, the reception was nice. They having gone to a traditional public university, I mean, you walk in and you get offered water. It doesn't happen. I mean, we've been to school. No one offers you water at
true.
Yeah, I was like, wow, it's water, and it was still water from the tap. So
it's amazing what water can do.
And I was pointed to a coffee station.
Wow.
And it was there was the way that the desks were set up about conducive to the learning environment. I did not know any of these things.
Wow.
So I then went to Varsity College. The reception wasn't quite as welcoming, but I was like, okay. I then presented the options to my sponsor, because these places, you need to sell a kidney to get in. So I presented these.
I hear you.
So he was like, you know what, as much as SACAP was charging more, he felt maybe that would be the direction to take, especially because it was a lot closer. So I then applied at SACAP, and I met their minimum criteria, and I got in. They complicated process.
Yeah, look, I mean, I think, now the higher education, the private institutions are contributing high into graduates that they take, actually matriculants, because I mean, the competition is very high in public universities. So they are really making a huge contribution. But I think their standard also has risen and they're getting more popularity. Actually, now they're taking more. So they do help. But I think, I mean, it goes with the price they charge. They try to also make their standard very good, to be very competitive, but also to match what they're charging when people pay. You feel like it's worth the money. But I don't want, and I'm glad you are speaking about it, because people, I think, needs to consider that obviously finance is always an issue. But I mean, if you can get private funders who are willing to pay for it as well, I mean, go for it, because people ask questions. Will it matter whether I do psychology at private or public? It doesn't matter. Psychology is psychology. As long as it's registered, not fly by night,
Yes.
it's not under a tree somewhere or under Mbanji somewhere, you know. So you get there to SACAP, yeah. And how was it doing honors at SACAP? I don't think I've ever asked this question. How was it? How's honors at SACAP? I know people who studied there, but I've been asked this question on an interview.
I guess the question is, how is it? I'm doing the honors now at SACAP.
Oh, yes. You know, in my mind, you're already in the master's class.
You got assignments.
How's the honors? Oh, yes, I've got somebody actually in the honors class who keep up, the one whom you are mentioning, who keeps updating me, because I think they had to do some research work and all that. How is it? How's the honors? I think you guys are about to finish now.
Yes, we're 5 weeks away from the end of the torture, because that's what it feels like now.
Look, all the honors are like that. Yeah, my master's is worse, but every honors in psychology, a proper one, accredited ones, yeah, they're like that.
It's an experience. I won't lie. Private, just the private institution in itself is an experience. It's an experience that is it worth the money? I think so. Yes, it is. At this stage, I think it is. There's a lot of attention to detail. The classes are kept at a minimum, so I do like that. So 15 students in a class, lecturers know you by you know, you're made to feel comfortable. There's the engagement I have even with my work. Having studied even radiography, I had the privilege of getting into a career where there was limited numbers. So there was only 23 of us in undergrad. They only took 23. So I'd been in a situation where there was small numbers, attention to you got attention from your lecturers and all of that. But here it definitely goes the extra mile. In terms of the workload, at the beginning of the year, I didn't feel the workload, I won't lie. But I think the distraction of going for selections and applying for selection creates a backlog in a student's life. So I think that's maybe another reason, because even at SACAP and most institutions, they encourage you to do it after your honors year. So I'm definitely feeling that the backlog from that 3 weeks or even a month of not being okay because of the master's selection, because I was not okay. I was going and coming back and going. It was bad. So
sorry, Anelisa, just explain to me what happens during the select. Do they give you guys a break or what?
No. So the work is on as it should. So they are very clear in the beginning that yes, consideration will be given to you in terms of not being marked absent, but it's still your responsibility to keep up with your work.
I see.
And also, they want you to keep up with your work. And also they do say, we would advise that you complete your honors and then pursue the selection process into masters.
Okay, you know what, I've heard that, and my because I've been struggling to understand the rationale behind it. Do they explain what you must do the following year?
The following year is in how to apply.
No. Like if they say apply after you complete your honors. So when you complete, there's a gap year that then must occur. What must you be doing in that year? Do they explain that?
They are very well. Firstly, during, I think it was April or beginning of May, they have a master's enrichment course. So they talk us through the whole process of application, what you could do to better secure yourself an interview. So all this advice on the volunteering, where to volunteer, and they actually would give you the relevant people to get in touch with within those centers. So they do that. So they advise you to volunteer during, let's say next year, I will be volunteering and going for master's selection at the same time.
Okay, so basically that recommendation is that during that gap year, use it for voluntary work.
Yes.
Oh, us from the township, it do not have worked. We are too hungry to be spending a year volunteering. I need to go look for a job.
That's another thing. I think that's not always, because I actually did advise them that, you know what, we're not all coming in from the same walks of life and with the same intention. So I'm 35. I am not looking to wait another year before applying.
You don't have the liberty.
I
don't have the liberty. Time is not on
time is not on my side.
Time is not on our side.
So they take advice very well. Like they've now said they're going to shift the master's enrichment course to February so that people who do want to apply have the relevant information to start applying when applications open. So there is also another very nice thing with them. When you raise a point and they find it relevant, they make changes.
Yeah, okay. No, awesome. They are, I wanted to say, I mean, there are advices which are good. They might not be practical for all of us, you know. And I think as much as it comes from a good place, you know, from the right place, sometimes it doesn't work for everybody, and people need to take it from that perspective, because I hear it a lot. People ask me on Facebook, you know, you must take a year. I'm like, for what? Because I do a lot of career guidance, and I hear about a gap year for matric. You know, in matric, actually, it works against you if you've got a gap year, because when you go to varsity, there's an allocation of space for those who were in matric the previous year. So they need to take a gap year. You no longer belong under that category. You are not a first-time entering student. You might have done whatever, but you are not fresh from matric. So, but anyway, that's fine. So you are there, you do your honors. Did you have to go through selection?
No.
Process, like an interview for honors?
No, this is what they need.
Okay, that's the selection process.
Good marks and that situation, and that's it. But here's another reason that I actually found out while I was in the selection, why they don't necessarily encourage us. Some content that is asked during the interview was not yet covered at school.
Okay.
So if you
like what?
For example, role playing, you are asked to what therapeutic approach would you use to counsel the patient or to provide intervention, and we had not covered that at school.
Sorry. We have covered it already on the channel. Sorry, they're behind with the curriculum.
We had not covered it. So there's that part of it. So
sorry, they must send their student here. We're already ahead with the curriculum.
You are ahead with the curriculum.
We're already ahead with the curriculum. Yeah, look, I mean, it's I mean, but at the end of the day, I mean, it's I think if one wants to get into psychology, these things you can learn them, you know, because everybody has got a study guide, has got outcomes of the study guide. I think psychology, particularly more mature students, to understand how learning process are, what study guide are used for, and how to use them appropriately. You can teach yourself, because master selection is not that theory based or theory content based. You know, it's more about yourself, your maturity, your development, and your knowledge of psychology in general. You can be an A student and go there and still, you know, fumble. Yeah, but look, I mean, I think it comes from a good place and understand them. I think they're looking after that student. I'm sure it also adds some value for them. Many of them got records of how many of their students completed their honors and got into the masters, which makes sense. And I mean, if they're putting effort for you to get accepted, I think it's a good thing. But people need to just be aware that it's just an advice. It's not that you have to. It's just an advice. You can take it. You are here with 10 modules, and imagine now. I mean, and the same with you. Somebody could have told you, Unisa, take it easy here. People fail. Take 5 this year. Next year, take 5.
I'm not doing that.
You know? So, yeah, but I'm glad you are bringing that. So there was no selection. You got into the honors and you applied in June for master selection. Where did you apply to? In March, rather.
Everywhere, even under the tree. I applied even the one that was under the tree. I was like, you never know. I put the CV there.
Wow.
Everywhere.
Wow. And did you only apply for clinical psychology? Hi friends, just a quick break. I know you're enjoying this program, but I just want to answer some few questions about people who still want guidance on how to access the book. You know what I usually recommend, that make sure that you get an ebook. An ebook, you can get it on Amazon and follow their process. Just click on the link below this video and then follow their process and you'll be able to get the book. I like the ebook process with Amazon because it is instant. You buy the book, you get it immediately on your gadget. But if you are in South Africa and you want to get a hard copy posted directly to your home address without leaving your house, all you have to do, there's a link below this video from our printers who were kind enough to help us with distributing the book. All you have to do, click on the link, fill the form, and they will be able to communicate with you on how to get the book. Usually it takes about 72 hours to get the book to you, and many people have been getting their book, so don't be left behind. See the links below this video on how to get the books, whether on Amazon or for it to be posted to your home address. So don't waste any time. Many people are getting the book, so don't remain behind. Make sure you get your copy while there is still time. Don't wait for the last minute, because the book will actually share with you on how to also prepare for the application, what you have to do, tips that are necessary even before the selection process starts. So make sure that you get the book as quick as possible. Let's go back and enjoy the program.
Only clinical.
And you applied everywhere?
Under the tree. In case they get accreditation, I will everywhere.
Wow. But then why did you apply everywhere? Because I mean, and I'm asking you this because you are still new into psychology. You don't know our traumas. You don't know the issues of psychology. Or did you get this from Facebook that hey, you need to...
They said, someone said, I actually have a feeling this was said by you or someone who's as senior as you in the profession. They said, you don't pick a university picks you.
Not true.
Like, say no more.
Yeah. No, look, I mean, and for those who are watching, I do advocate, and I think this year I've emphasized it a lot to say, what I've noticed as well, I mean, majority of the people who got selected, the same year they were rejected somewhere. So you never know which university might pick you. You know, make your chances more broader and higher by applying everywhere. I tell people, as long as you can have the money, you know, and I don't want to take it for granted that everybody will have money to pay for the application fee because they come with a price. But I tell people, if you are volunteering, you are working part-time, save money to apply everywhere. Because you never know, you know. And that's something I've seen. So even this year, the people I've interviewed, all of them, they were rejected the same year they were accepted. You know, everywhere. I've never actually ever come across anybody who's applied for 5, all the 5 selected me. I've never come across such a person.
Never know.
Coming. I'm still waiting to see that, but I've never. I mean, the latest person I've interviewed last week told me he applied to 3, got invited to 2, got rejected, but only accepted at 1. So it's always safe to say you never know, just apply
Yeah.
everywhere. So you applied everywhere, and where did you get invited?
So I think before I got invited, hence I'm saying I had a terrible July. And I had
Okay.
terrible July. So I applied everywhere, and being a person of science background, I applied the logic that if I meet the minimum requirements and exceed them, which the minimum requirements is 60%, and I was sitting at 3% with my average for Unisa and even my first 10 modules at SACAP. So I put all the minimum requirements that they want in terms of age. I'm sitting there in terms, so all these measurable things that they usually put out there, I felt I met and I exceeded them. And I think my first rejection came from roads of Wits.
Sorry, when you say now that you have brought the requirement, when you say you have met them, we're looking at about how much so? Average.
My average for Unisa module was 83%.
Okay.
And my average for the first term modules at SACAP, first term, because their first term ends in May, was 82%.
Wow.
Yeah.
You at Facebook who keep asking me what percentage must I have? At least you have a head. I'm not saying this is what you must have. At least I've answered your question on Facebook.
Yes. So that's what I
Yeah.
had.
If you need clarity, Anelisa will be there. Just check for her. She's very active. She'll answer you. Okay. I don't even think I got, mine was not 82. I think my honors was about 70 something. Did I get 80? No, why do you were really working hard here?
I was. So because I felt I met these minimum requirements academically, socially, in terms of my way I was in my life, and even with a background in clinical, because a radiographer is a clinician.
Yes.
I had a background in that. I had a background in research. I'm published. I was like, wow, what a candidate. What a candidate
Wow,
I am.
wow,
You know?
wow, wow,
Then-
wow. The mindset was there already.
you know.
Ah, no, but it's a good attitude, and you need to have that. I tell people psychology can be discouraging. I mean, I had somebody on Facebook the other day, you know what, this course can kill you. I'm leaving it and all that. And I tell people, I mean, it happens across many professions. You want to be a CA, you want to become a doctor, you want to become a lawyer. Most professions, they've got their own issues. And
Yes.
psychology might crush you, but you need to encourage yourself. You need to keep that positive attitude. So I like that. I like that mentality.
But that was the attitude I went in with. And then when Wits said no, thank you, I could not understand. And
Okay. So first rejection came from vets.
yes.
Okay.
And then roads not too far behind came in with another no, thank you.
Hey man, roads. Okay.
Roads. And then I think UP, was it UP? It was Roads who interviewed. It was Unisa. Unisa didn't even qualify. Roads said no, thank you.
What do you mean Unisa did not qualify?
Because you need to have completed your honors.
Oh, I see. So they want you to have the honors for you to apply. But you applied anyway.
No, I didn't.
Okay.
So I didn't. Oh, Cape Town came in and said no, thank you.
Even UP, you said. Did you say UP as well?
No, UP. They sent out their invites.
Yeah.
And I did not get one. So I need people would say UP is they're officially out, and Cognition and Co will make you have a heart attack.
Yeah.
They sent those and I didn't get one. I then obviously assumed that I've been rejected. UJ sent me a rejection as well. And I think at this stage, because I now realized, I think it now dawned on me that I just may not make it through. this year, not even for an interview.
Reality
And
check now.
Yes, it kicked in. And then I started about 10 years of application. This is my 3rd cycle. It sounded like IVF. You know how people are like, this is my 10th cycle. And I think this is at the time where even my husband says, I don't think you've ever dealt with rejection. You know, that's when people start.
I'm sure even on Facebook, you are starting to lower your comments. You are now watching.
I was quiet. If you can look at those times, you don't see comments from me anymore. So I was
That's why when
down.
you contact me, I'm even forgetting who's Anelisa. Because we are very quiet during that season.
I was not okay. I was not okay. I couldn't focus on my assignments at school. I'm trying to figure out what is wrong with me. I am going through the most.
Wow.
I eventually got to a point where I was like, okay, I've been rejected. I now need to actually zoom in on why I could possibly have been rejected. So then
you are canceling yourself now.
Yes, I went through I'm a very practical person. So I went through my autobiography. I picked up 20 million errors. I went through a lot of things, picked up, okay, areas of improvement. I'm like, okay, after I finish my tests and assignment end of the year, I'm going to rework my autobiography. I'm going to rework this. I'm going to rework that and be ready for cycle number 2.
Wow.
And then I was fine. After that, I was okay. And immediately, I think 2 days after I'd made that decision and actually started planning my December around re-preparing for the application processes next year, I got an invite to Potchefstroom that I had applied to because I had time on my hands.
That's Northwest University.
Yes.
Okay.
I then went and Googled who Potchefstroom is. Potchefstroom was.
Oh, because you just throw in order.
Okay. I Googled Potchefstroom. I was like, okay, it's fine. Potchefstroom is happening. And my husband counseled me again. He said, listen, this is your first interview. Nobody's gets in on their first interview. You are going there to practice for next year.
Your husband must come to Facebook.
He said, I'm going to practice for next year. And I will next year, whoever interviews me first after next year, I will get in. I was like, okay, baby. And this was fine. And I found out that he had to take off work because he was worried about me not being okay.
Sure.
So and then I think same day or 2 days after that, I got another rejection from UJ. So UJ rejected me twice. They went the extra mile.
How?
It was nice. It was nice. I think they wanted to make sure I don't show up.
So, okay.
Yes. So I booked my flights for Potchefstroom. I told my lecturer at school that I was going for a selection at Potchefstroom. This is another upside, SACAP. When I tell you it was hands in, everybody in, I was being prepped for that selection. They were doing role play with me. Fellow students would come in and pretend to be patients. They were doing interviews, like mock interviews. They would sit there with my autobiography. I had another one of our lecturers, she would sit across from me and she was triggering me to a point where I cried and she was surprised. She'd never thought I'd cry. She said, I thought you were so hardcore. So they went hands in.
Wow.
And I was
so they
prepping.
do that with every student to go for selection.
I found out there were three people that went for selection this year, and all 3 of us apparently got the same treatment. So as soon as you tell them, what do you need help with? If you want help, they'll help. If you don't, then but they are prepared to help you.
Wow. Big up to SACAP.
I also got a crash course on treatment interventions, which were not covered, which are being covered now. So one of the lecturers sat me down, literally gave me a crash course on CBT and this the Freudian. She said, whatever comes in role play, those are the 2 treatments you give. Just pick one. There. You can justify it in every direction. Just pick one there.
Wow.
I was prepared. I was good. And I think it was on Tuesday after class. I got a call from UJ. I'm like, UJ is doing the most. Now they're calling me to tell me not to come. I'm like,
Okay.
so I didn't even respond. I just picked up the call and listened. And the lady was like,
So what do you want to say so that you can go?
you know, and she was like, it's Anita. We know it's short notice. I said, I'm coming. They're like, we're wondering. I said, I am coming. She said, we will send you an email. I said, you don't need to send it. I am coming. She said,
You don't need to apologize.
I don't even know what you wanted to say.
So did she get to explain why they rejected you? Now they're inviting you.
She said to me, eventually when she got a chance to speak, that the candidates that were invited, a few of them got taken elsewhere and some were not coming for whatever reason. And I was on the waiting list for
invite. Wow.
Invite.
Wow.
It was the Tuesday and I was expected to be there the following Monday.
Wow. No, then, yeah, you are raising a very important thing because I interviewed 2 people this year. Both of them actually got accepted at UL and they had to reject invites to other universities. And I told them that, you know what, it's such a courtesy to do that.
It is.
Now you are coming on the other side. You were actually the one waiting. You were one of the ones waiting. And I can't recall if UJ was one of them, but you are raising an important thing. And I think anybody watching, if they do get to be in the same situation where they get selected and just to cancel others, particularly if you know, I don't want to go there. I mean, you know you want to go to UP. UP took you. Why do you want to take space somewhere else while they can open it for somebody else? I mean, look at you now. So you are actually benefiting from somebody being selected somewhere.
Yes,
wow.
I have.
And you got selected now from wow. It's amazing how things work out. Okay, so you get to know that somebody canceled and they're inviting
and
you.
I'm going. So I'm now literally, this is Tuesday, the following Monday, I must report there. So
okay.
I call my husband and he's like, what about Potchefstroom? I said, we're practicing for Potchefstroom here now. So I went with the mentality that at UJ, I'm now practicing for Potchefstroom.
So UJ was Monday. When was Potchefstroom?
In September. So it was, I think, the first week of September.
And this was when? The Monday was when?
I think it was the 14th or 13th of August.
Okay. So you still had like a long time in between.
Which I already accepted because their invite came in a lot earlier as well. So I then obviously I booked flights. I went to Joburg the Monday. And so they gave us a nice breakdown. On Monday, we had an open book exam, research.
You are from UKZN, eh?
I'm from KZN, yes, Durban.
Yeah. Yes, Durban, sorry. Yeah, for context. Yes. Okay.
Yes. So I stayed with my brother. So my brother's based in Rosebank. So I stayed with him for the week. So that was another upside that I didn't have to book accommodation. So we had an open book exam on Monday, which was research. And then we also had a group activity. And then the following day, we were going to have a one-on-one.
So what was happening during an open book? I once had open book in my life. It didn't go that well. I'm wondering, what did you guys do? I felt the books were disturbing me. I wanted to just put them aside. So I'm wondering.
We did research. So we were told you could bring any paper-based content that you want. So it was based on research. And research being one of my favorites, I had a whole suitcase there. Literally, don't laugh, I'm serious. I had a suitcase. People thought I was from the airport, but no, it was books. Because I was not gonna not be ready.
Sure.
I think Professor Kumalo walked past me to say, talk about being over prepared. I said, you never know. You just never know. And I asked.
I can imagine.
So it was I think it was a 2-hour paper. It was a lot more focused on comparing quantitative and qualitative approaches. all the way to what do you call this? This your grounded, your critical theories, yes, all the way to
Okay.
that theories that suit qualitative. It literally wanted, I think it was a
The
way
design
of
that you'll use, and then the methodologies, and okay.
all of that to trustworthiness, all of it,
Wow.
given raw data, write a topic that would be quantitative, write a topic that would be qualitative.
Okay, nice. Wow, that was very good.
It was nice. You know, when you write and even brush the paper, I was like,
Wow.
wow, these people though. Wow, I have never enjoyed a paper that much.
Wow.
About starting off on a strong point.
Wow. Those who don't know who are scared, please, there's a video I've done. I think it was about research. Please check it out. Don't be scared. We want you to enjoy as well. Wow. No, that was very good.
I enjoyed the paper. We went out, we had a brief tea break, and then we had group sessions, and we're grouped into 6. So in the group session, you know, obviously you chat amongst yourself as the group. I quickly picked up in the group, it was strong candidates. So 2 of them were shortlisted somewhere. Another one had been to UJ at least twice and had gone all the way to role play. Another lady was shortlisted at Rhodes. Another gentleman was shortlisted at Stellenbosch. So 2 were shortlisted at Rhodes. One was shortlisted at Stellenbosch. Another one had gone up to role play at UJ previously. And then there was another girl who had a previous master's in research psychology, the academic one, and then it was me. So from this, I could pick up. I've been put with people that
it sounds like it was intentional. They know all of you, so they put you knowing here.
No, but for me, and it was nice because there was as much as we encourage to be team players, it doesn't always work like that. There was even you waiting in the tea round, that weighing of where people are sitting, and as soon as you say this is your first interview, you're still in honors, people are very quick to dismiss you. You know, so even within my group, there was that conversation. Oh no, it's my first selection. I'm still actually doing my honors. And there's like, oh okay, this one is here for numbers. You know, okay. I was there. Around, I was making jokes.
They end up advising you that, you know what, just take notes, and the next day at least you'll do better.
And you know, and when you ask people questions, they're very eager to answer to you because you're not seen as competition.
Yeah.
I've never necessarily thought I was competition to anyone. I was there to make sure I get in at Potchefstroom. That was my goal. I
feel you.
I'm happy. I was getting advice. I was having a good time.
Don't take it too hard, you know, when I'm not selected.
No, I was happy, and I met people that I had seen like on the group that had been selected to 6 other places. So I was like, wow. And also having been called in late, I figured even them, they were feeling enough.
Yeah, clearly, you are just a substitute. They just
yes, I'm not the intended target market. I am not the target market. So it's okay. So the room, they would like talk, and you know, we've been told you'll be given a topic. I mean, we've been told what happens there, and we were just expected to talk. And I could see now everybody's taken aback, including myself. There's just this talk, and one gentleman, he had a presence about him. And he asked them, is there a specific thing you'd like us to talk about? No. Is there maybe a night? They're like, no, whatever. And that was that. The room went silent again. And the loud mouth that I am, I was like, oh, well, like, okay, so maybe let's introduce ourselves. That looks a bit logical. You know, yes, preparing text, but who are you, you know? So I then started, obviously.
So sorry, Anelisa. So when it went silent, did you start introducing yourself, or you suggested that let's introduce ourselves?
I suggested, and then I also initiated the introductions as well.
Okay. No, that was very good, because I think I did a video this week to say nobody's gonna give you an opportunity at selection. We might drink tea together, be at the cafeteria together. When we enter the room, we are competing. And if you have an opportunity, take leadership, because already by that it gives you an upper hand. You know? Wow. That was great.
Yeah, so I
Now the
did that.
underdog is leading now.
That's the first. And the thing is, when I was being prepped at SACAP, because SACAP, their classes are very interactive and there's a lot of discussions. I was told that what do you call this? I dominate conversations. So I tend to speak, and other people may feel intimidated to follow after me. So I was now sitting here and trying to work against this domineering part of me in a conversation. And now I'm being put in a spot where I need to start the conversation. So I needed to actually put an effort to being inclusive, to opening the floor after me. So I was now sitting and thinking, I need to, because most people are shy to talk. I'll talk. I'll talk to a complete stranger, 2 hours, no problem. So, you know, I'm one of those.
And you can't help. It's silent. What must you do?
What must we do? We want conversation. So the conversation then started. Someone else said, let's tell each other why we got to psychology. And again, they just turned and looked at me to start. And I was sitting at the beginning. So it started to look like, you know, I then realized that the conversation was starting to be centered around me.
Okay.
So I tried to move the
things
conversation.
were working for your favor, Ms.
But it wasn't, because I didn't necessarily want that attention on me like that. And I figured it's an opportunity for me to recenter the conversation to a different person, or to a way that it doesn't need to all start with me, you know, just redirect the conversation and then the flow of the conversation to a little bit more popcorn and not in a row.
And how did you do that?
I think I actually, when they said, let's introduce ourselves, I introduced myself. When they came back and asked how we got into psychology, I said it, and then I went and spoke about something someone else said in their own introduction, and then nominated them in a way to follow me. So this now stopped the role situation where the person next to me now needs to go. So I then said, like, I think I actually used the gentleman that was there. Who, I don't remember. I think he was Ngosi, his surname. So I then said, Ngosi, you actually said this when you introduced yourself. Is that why you got into psychology? So I then got to be the one who follows me instead of the lady next to me. And then this initiated a random talking of, there is no need to now go in a row.
Yeah, but still you did well. I mean, look, I think from the fact that everything centered on you and you initiated, which also gave you an upper hand, because then you can direct, you become a leader, you stand out. And when it comes to you, you still get an opportunity to speak more than other people, because you are speaking now, everybody still haven't had their chance. But you are able to now direct the conversation in a random way, but still you are not shifting anything from you per se, but you are still having that opportunity to show that you are a person who can lead a conversation. So I mean, it worked to your favor to some extent. Okay. Anyway, you have done the work, I mean, by being the first person to speak. So, okay, then that went on.
So that went on, but I will say the fact that the other people were sitting where they were in terms of the selection processes and their experience did come up, because the conversation, there was intentionality in involving other people, and they were not agreeing with someone. For, you know how they say, I fully, as I hear what Dr. T is saying, and this, so not acknowledging you for the sake of acknowledging, but actually adding on to what you're saying, not just, you know, because how we always told, acknowledge the previous speaker, but you just acknowledge them by saying, I hear what
I agree with what he said, but you are not talking about the content of what he said. You are not, you're not elaborating. So you might not even have heard anything. You actually
exactly. There was definitely, and they were not agreeing with someone for the sake of agreeing, which I also realized when I went to KZN. Some people would agree with you for the sake of agreeing, and they were willing to challenge an opinion. You know, so another one challenged my opinion, which I was like, wow, this is nice. I like being challenged. I was like, this is nice. You know, they would challenge you, you know, like, I know this and this to be a fact. Where do you come with this opinion or perspective, or where do you base that on? You know, to be asked a question like that, and in a very nice manner, because they were, you don't also want to sound aggressive. I guess they also didn't want to sound, but I would then and then say, anyway, when like, I don't know, Banban said something similar. What were you basing that on? You know, so there was definitely that challenging. So I picked up why they were sitting where they were in the waiting lists, or, you know, with their experience. So after that, the following day, we had obviously the group, the individual interviews. Again,
sorry, before you go there, so did everybody on the panel, on the group, get the time to talk?
They did. There was a lady who, unfortunately, again, for her, she was sitting on the other end and by the door, and I could see her disappearing. I could literally see her disappearing, and I tried to make a bit of an intentionality to say, what do you think? Ban is sitting over there because she's wearing her name badge. When I tell you, I felt so bad for engaging her, because she was looking for the nearest door to run out of. She just went, no, I don't want to say anything. I'm okay. You know, she just.
How?
I then ended up feeling bad. You know, like,
but
maybe.
Then why? Because you are at the selection. Why would you not want to contribute?
Yeah, but then I felt then maybe she might have felt I put the spot on her, or, you know.
You need the spot. That's the only way to make it. You need the spot on.
So she went, you know, she went straight into the bed. And funny enough, she's actually contacted me since then and asked me to give her an honest opinion of my experience of her in the group. And I told her if she's okay with me being honest. And she said, and I gave it to her good and proper. And she's like, I felt the same way. Could you really see it from there?
Sisters Banbani, please, let me help you. You need to talk.
She did say she was feeling exactly the way she was looking.
Yeah, look, I mean, was it the first time?
For her?
Yeah.
No, apparently it wasn't.
Yeah, because, well, either way, I think it doesn't matter, because I had people went there for the third time and they have a mind block, they've got stomach tummies, they've got, there are many things that happen. But it can be overwhelming. But I think that's why I tell people you need to really be prepared. And when I say prepared, I mean even mentally, you need to be ready for that situation where you are going to be put on the spot, where you are clueless and, you know, it's moving. You can see it's coming to you and you've got no idea what you are going to say. But I think the most important thing is you need to take opportunities. There, I tell people we enter a room. Yes, I tell people don't be too aggressive. Give other people a chance, but you need to keep in mind you are competing. We might eat together at cafeteria, but when we enter the room, we are competing. There's a competition. There's that element, and you can't just be, you know, stand alone there and not participate. That already is a total exclusion on its own. Okay, so that happened, and yeah. So the person still has your contacts. You know her. Was she from your...
contacted me later on. Because Telegram, you can pick up on someone's name. So she contacted me on Telegram and said, are you the Lisa that was in group whatever with Manba? And I said, yes. She said, can I have your number? Can we chat? And then we had a chat about it.
Yeah, she must just follow up. At least, you know, now you are selected. Now you can advise from somebody selected now. Say...
But I think she wanted to know how we experienced her. And she actually was shocked to find out it was also my first selection. It was my first selection while it wasn't hers. So she does say she's an introvert and she finds it very difficult to have a conversation with people.
Yeah. Yeah, look, I mean, it does happen, but I think when you get there, and it doesn't matter whether you're introvert or extrovert. I think at the end of the day, I think it's about your personality that comes out. Let them judge, you know.
Yes.
But you cannot not participate, because by nature, psychology class are like that. Funny
got
how that's how classes are in psychology. They're
they are.
intimate, they're small, and they're engaging. You are going to have to speak, you know.
You have
But
to.
I'm glad at least, you know, I think what I see in her from what you are saying, there's at least that reflective mindset or approach or maturity, you know, for somebody to be open to critique and
Mm,
allow somebody to give them their honest feedback. So
mm,
there's still hope in that regard.
mm.
It's just a matter of her working on herself. I mean,
And
yeah.
so
But anyway, yeah, please continue.
then the second day was then the individual interviews. I think most of us went in there thinking it's going to be about your autobiography. We weren't given much direction there. But when we got there, it was very generic interview questions. It was first why UJ?
Yeah. Another good question.
Yes,
Yes,
it
yes.
was
I would
why
have asked that
UJ.
question.
Why UJ? What else? Your strengths and weakness, which is a trap. This question is always a trap. That one,
Yeah, good question. Good question.
but it's a trap because
Yeah.
they then go and ask you, how do you feel your weakness will hinder you in a therapeutic environment? You know, so
Yeah. Look, it is a look from somebody who has to answer might sit like that, but from a psychologist, we want to see insight in your own understanding. Know your weaknesses, know your strengths, and how they can hamper you. Because if you don't know, you are not even aware of your blind spot. That can actually be a hindrance.
yeah,
So it is a good question. I think I've touched on it on the Q&A video that prepare for it. I mean,
it's
I
coming.
think it's a good question to ask from a psychologist's perspective.
Mm.
It's a very difficult question to answer for the one who has to answer.
Effective.
Yeah, it's not an easy question to answer, but it's a good question to ask.
Yes. What else? It was they were very they were not there was nothing special about the questions, but
Yeah.
you try to be honest about your own response to those questions. And I also found in the groups there's this need to look at approaches and what is the approach of the university, all of this. And I do get the value of it, but I don't think we then now try and sit and try to go there and conform with this approach of theirs. And for me, because I am what I am, and I think at 35 I can't fake anything anymore. So I was very honest to say, you know what, I like UJ, and this is what I liked about it. And I did like the definitely there's a lot of focus in African perspectives, the diversity within their environment, the teaching staff, so I expressed all of those things. And even another one, how do you handle stress? Those ones. And I think there, what I even told a friend of mine who was going for counseling, I said, what they look at, we've all got these generic answers that we give, that I want to end the stigma about mental health care. I want to do this. I want to inspire people. But yeah, so how? So I said, you need to be practical about your response. We want to end stigma. How? What does that mean? Be intentional that I actually want to do X, Y, and Z, which will aim to do this, which is ending stigma. So I was very practical about my responses. Like when they say, how do you handle stress? I don't say I've got a strong support. I said, yeah, I don't handle stress well sometimes. So I go to the gym, I do this, I do that. So I'm practical about my responses. I go to the gym, I try to do this. So I'm not saying what they want to hear. I'm telling them what I do. And
have you seen my video on Q&A?
I haven't. I don't think I have.
Where I speak about questions and how to answer them. What you are saying is very profound, and I wish people can listen to it, attentively, because you are saying a very important thing. Don't just say things, make them practical, let them apply to you, So yes, please continue.
And another question, what would you do if we rejected you? I said, I'm gonna cry. I was like, I'm gonna cry. And I could see this lady, maybe she was expecting me to say, I'm gonna be strong. I said, listen, I'm gonna cry. Firstly, I think we just need to start there. I'm gonna cry very hard.
I will think later.
I will be disappointed in myself and you. And I'm not even you. How do you let this go? You know, so I was myself. So I told them I'm gonna cry, and I told them I'm gonna apply again. I mean, what else is there to do? I want what I want. And they also then asked, have I been called to any other place for a selection, or have I been for a selection process before? I was like, no, you're the first one to get a shot at all of this. So ain't well. Ain't well.
And so did you tell them you rejected somewhere?
No. They were asking, is this my first time for a selection? So coming to a selection interview.
Do I get you? So they didn't ask you if you rejected anyway.
No, they asked if I've been for a selection anytime before this. So I said, no, they're the first one to get a shot at all of this. And I actually said it like that. I was like, no, you're the first one to get a shot at all of this. And I could see, and you know, when you can see a panel member wants to laugh, but they're trying to be serious. I could see they want to laugh, but they're trying to maintain a straight.
Yeah, no, you were correct and a half.
It's fine. I was not gonna leave that room not having had fun and enjoy that experience.
I like that. And it helped you to relax, to be yourself, because sometimes you try too much to be this persona, but it's not yourself.
Which it doesn't. And then that afternoon/evening, they then sent they cut half of us to call for role play for the Wednesday. People, okay, obviously in the group, the cognition group, everybody's going on. Has anyone heard? And I think UP was also sitting in the same boat waiting for emails. And after a few hours of sitting and waiting for emails that are supposed to come at 3, I decided, you know what? I'm gonna go have cake and call it a day. And literally, when I was buying my cake, it came in. I was selected for the role play.
Wow.
I was like, okay, this is nice. I then went home. I revised therapeutic approaches. I think I had an afternoon slot. I went in and I had one panel member, which was from the day before, and another new panel member. And they said they're going to bring in a patient and explain what they expected out of me. And I was like, okay, that's fine. I then asked questions. Am I allowed to take notes? They asked, do you want to take notes? They said, we don't encourage it, but do you want to take notes? Do you need to take notes? I said, no, the notes are for me to be less nervous. So I actually want to just something to keep my hands nervous, from being nervous. It's more of a distraction for me. They said, if you don't have to, we'd rather you don't. And I was like, okay, that's fine. My patient came in crying from the door. From the door.
So was your patient one of the students, or was it like a staff member?
It was one of the master's students.
Okay.
And they were crying from the door. And there was a time I actually paused to maybe think, did they say we are having someone act as a patient, or they actually bring a patient? Because I now needed to know, are we pretending here, or did they bring in someone from across the road? You know, when you start questioning, the acting is a bit too good. So she comes in, she's crying, she's there, and she sits down, and I'm trying to calm her down because I need to have a conversation with this person. And she then, I'm like, you don't ask how are you. I was told, don't ask how are you. I'm like, so what brings you in? And then she says, I had a baby 3 weeks ago. And when she said that, I was like, take diagnosis done. Now we can chat. There's definitely that pressure of, will I know what's wrong with the patient? And I think once that ticked in my head what was wrong with the patient, we could now have a conversation about it.
Exactly.
While that was not necessarily the primary reason. And then, I had to now intentionally stop myself from doing a checklist in my head. You want to confirm, okay, do they experience this? So I didn't want to start directing a conversation to my checklist, to my mental checklist of this disorder. So we started having a conversation. I would pause sometimes and just let her cry. But, so, this would go on, and she went on and on and on. And then she in somewhere in the beginning, she told me about why she understood why women kill their babies. And when she said that, I obviously, the basics, we need to detain you, we need to maybe seek. She denied it. And at the end, again, she went on about how she just wants the baby to shut up and whatnot. And
Mm.
again, I then again stopped the conversation and said, you know what, this needs to be done. And then they stopped their role play there. They sent me out, and then they asked me why I kept insisting on having the patient, institutionalized or admitted or whatever. I said, because she's going to kill the baby. They said, but she said she isn't. And I said, but I know she is. And then, we had this, they said, you've stopped her twice. She said she isn't. You are insisting. I said, you know what? She's given me this symptom and this symptom and this symptom. And literature, you know how we always say literature, but you can't quote even one person. I said, literature teaches us that when someone says, I want the baby to shut up, they're going to shake that baby.
Yeah.
And I then said, obviously, it is also at the discretion of the clinician on this mind, on whether the patient is going to follow through on this, on what they are saying. And I have digressed. And I actually said, I have digressed. And they looked at me to see, did I say this? And I kept quiet because there is no English word, but we have now said it and we are going to commit to this word. Because it doesn't exist.
Yeah, no, it was interesting to watch you are from the other side. I can imagine.
Said, I have digressed that she is going to end because I am the clinician here. And I was the clinician. I was like, it's me. This woman is going to kill this baby. And next week, you are going to call me and we're going to have other illegal problems if I don't admit her. And they could see, and again, I could see they want to laugh, but they're trying to maintain this composure. But I was like, okay, I'll let them go.
No, but it went well because I think actually UJ is very good in terms of dealing with patient, particularly in terms of hospitalization. I've never, well, I don't know other institutions, but in terms of SACAP, which is their psychology center, I mean, their processes are actually way better than I've seen in other institutions on what they follow. And you might not have used their ways in terms of why you'll actually hospitalize, but I think you have touched on the basics that those actually were the correct symptoms in a sense that she verbalized it and there was some form of an act. She knew how she could do it. You want to silence the baby. There's a thought around it, an ideation around it. Although she has not said how it's going to do it, but I mean, there is a suspicion that she's a potential risk, and then you are taking that decision. Yeah, but my question now, when I was listening to you, I thought, no, this is good. I think your responses were good. They knew it, that when you're in that situation, you have to hospitalize. But how did you know about it? Because had you covered that at SACAP at that point?
Yes, that was psychopathology. So we did that in the first term, but we did not cover. Yes, we did not cover that disorder per se, but I actually had experienced it as a mother.
Okay, not from your work at the hospital.
No, I did the feelings she had, and at the timing of when she was having these feelings, immediately said postpartum depression, because I knew that feeling of not knowing what to do, of feeling like you're losing control and nobody actually understands the pressure you are feeling, especially with your first baby. So I had been in her position, and obviously it was briefly covered in undergrad as well.
Yeah, but then the aspect of hospitalization, where did you cover that?
No, from hospital, I know who we hospitalize and who we don't let go. And also within the therapeutic contract, which we always made to rehearse and practice before this selection, is should I feel you're a danger to you or someone else, I will intervene. So that was in keeping with that part of the contract. She was a danger to the baby.
Okay. No, perfect.
Yeah.
No, I'm glad you're bringing that because I think you're just making me think that maybe it's something that I need to cover because I don't know to what extent people who come for selection, they will have covered that before the selection. Because I think it can easily emerge where they ask you questions around that. I remember the UP, we didn't go, yes, we had that knowledge of the contract that you sign, whatever, but we never went into details. So when we are put in a situation, you need to now not only say literature, you need to dig deeper if you are asked questions, to provide the reference. But that's very important. Yeah, no, you are raising a very crucial thing. But it sounds to me, listening to it as a very difficult case, but you seem like you have handled it well.
It was difficult. There was definitely a lot of pauses in between the treatment with me and my patient, and the panel picked up on that, and they actually asked and said, why were there pauses? Were you thinking of questions to ask? And being me, I said no, obviously. I was not thinking of questions. No. I was giving the patient time to just breathe and not feel rushed.
But we have that as well in psychology to say, you need to allow them to go through the emotions. Sometimes give them a tissue and allow them to cry.
That I wasn't doing that. I was thinking of questions. And I could tell he knows I was lying, but he doesn't. What is he gonna say?
Yeah, no.
I was like, I didn't want the patient to feel rushed. I was here for her. I don't want her to feel like there's a line behind her. She must just take her time. This is her space. This is a safe space. Oh, I gave them the safe space speech. And then
them a textbook answer.
But we all knew.
Wow. Yeah, no, but I must say, I think it was a very difficult case. I mean, you sound like you have handled it well, but under different circumstance or different person, it could have messed them up. I think it was very difficult.
I also feel there's something my husband always say. He said they will always give you the most common things. So having gone even before I did that, he said, this is a South African context. It's depression, it's substance use, and some very adventurous universities might go and give you a personality disorder. But substance and depression and something trauma-related, PTSD, those, yes. He said that's where you are looking. They can be sub-rooted into another one, but he said you are upstarting, they're going to give you something common. And postpartum depression forms part of depression. And when I asked other people, it was similar things. Another one had PTSD, and I think another one had some psychotic disorder that also has an element of depression.
No, you are right. I mean, I think I also spoke about it sometime this week to say they can only ask you so much. They can't go too far out of psychology, even about yourself. They can't go. And I was giving them 3 categories to say they are going to revolve around these questions. And I think that's the way to prepare. You just need to, don't guess, know how to apply knowledge, because people want the exact question they've prepared for. If it comes differently, it throws them off,
And then another thing they asked a treatment approach, which, like I said, we had not covered that. So I'd been taught the CBT and the Freud psychodynamic. So the problem is that depression fits CBT, and the lady had spoken about her own childhood experience and her mother, which is now psychodynamic. So I then fluffed around and explained both of them. And when you can tell this person is going somewhere, but they're just not getting there. And they kept insisting on a treatment approach. And we went around, answered our questions, and they came back again to it. I fluffed around, and he eventually said, you know what? I actually need you to stick to a treatment approach and tell me which one you're using. And he was very adamant that he wants a response, and a justified response too. I then said to him, we've not covered this at school. I was honest. I said, we've not covered this at school, but I'm going to wing it. I said, I'm going to wing it here and say this on the basis of this and this and this and this and that. And then he was like, okay. And I wasn't sure whether that meant I got it right or got it wrong. But I, now having learned the approaches, both were applicable. So, yeah.
You remember what you said? Which was your response?
I ended up...
the memory you wanted to keep behind?
I ended up sticking with psychodynamic, because I based her experience and her expectations of what she should be as a mother on how she carried on about the lack of relationship with her mother and why the relationship she had with her mother is not what she wanted with her child. So that's pretty much what I felt, maybe revisiting that relationship with her mother and those expectations of a relationship that weren't met, and now her needing them to be met here and resulting in frustration, maybe an approach to look at.
Yeah, I think what I like about your approach, because and I think for anybody listening to this must also be able to put the two together. On one side, you are being honest to say, I'm going to wing it. I've not done it. We have not covered it in class or adversity, but I'm going to wing it based on this. You still have something to offer. You are not just ending on what you don't have. And I think for me, this is what I usually tell people. Don't only give us the limitation, the weakness. Also give us something. You get a point. You need to offer something that we can work with. And I like that balance in what you are saying. I think you were saying the same when you were speaking about the fact that they ask you are saying, I'm going to cry. But in addition, you are still giving them something on top of that. You're not ending there, And I think that's something that people can learn from this. You need to always provide a response that they can work with in the midst of your honesty, which might be limited. Yeah. Yeah, please continue. I'm really enjoying this. I wish I had this before I had my interviews.
I think I was in high school then. I think I was very raw. So after that, then I went out. I obviously after every session I debrief with either my husband or a friend. So I would debrief, and there was obviously the question, do you think you're going through to the final panel? I said, you know what, if I don't go through to the final panel, I would be happy, because I would be content that they are not looking for me. I said I would not fault them at all. This is the stage I was ready to leave. I was okay going home because I know I'd given them 100%, and anyone who was a better choice than me was an excellent choice because I'd given.
And I think, sorry to come in there, and I agree with you. I think your answer actually also provide an answer to the question I get a lot when people are being told that you need to be authentic. And for me, I think that's what it's all about. When you feel I've been myself and I've given them my all, anything beyond this, I can't, even if you were to ask me, I can't change it. I will have still done the same. And I think that's actually what you are communicating about: authenticity, being yourself and giving it your all.
And not feel you've sold yourself short. So that then we sat again and waited for the emails. And email came through. I was going, and by the time the email came through, I think my husband had already planned to come up and fetch me, because we were both sure, first time, there's no way I'm going to make the final panel. And I made the final panel.
Wow.
And the Friday. So he came up the Thursday, and Thursday I was now doing nothing because they split the 20 into 2 days. So the Thursday and the Friday.
So just for clarity, so you went they called you to start on Monday. So the research, the role play, the individual interviews were Monday to Wednesday. And then do you remember how many people were there throughout these 3 days?
On Monday, there was apparently 2 did not show up. I think there was 73 of us. And then on Wednesday, there was 20 of us.
Okay.
And then for the final panel, there was, there was 40 on Wednesday, I beg yours. There was 40, so they cut 50% on Tuesday. So on Wednesday, there was 40, and then for the final panel, there was 20.
So they were cutting every day?
They cut on Tuesday and on Wednesday.
Okay. And Thursday, they had cut, how many were you on Thursday?
So on Thursday, so then the 20 that were left got split between Thursday and Friday. So on
Okay.
Thursday, there was a final panel for 10 people. And then on Friday, there was a final panel for 8 people. Yeah. For Ima, there was a final panel for 12 people Thursday and 8 people Friday.
Wow. Okay.
Yeah.
So how was then the Thursday?
The Thursday, I was a scenting girl, but I was shopping. Stress was going with me, so I went shopping. Hence the recruiting of the husband. I needed funds, so I went shopping. So,
Also, Thursday you were off. You were
yes.
supposed to come on Friday.
Mhm.
Ah,
Mm.
and okay. And then Friday?
Friday, my time, I think I was the second last one to see the panel. So out of the whole 20, I was the second last. There was one candidate after me, and then the selection week would have been done. So
On what time? You
I think
remember?
12:30. 12:30.
Okay.
Yeah, I think it's
Okay.
12:30.
I think it was late in the day when everybody's tired and want to go home.
Yes, and it's late in the week. It's just, I was not sitting well. I was like, okay, maybe they're picking from the Thursday and they just want the waiting list on Friday. I've had this waiting list experience. I figured around 2 waiting lists. So, so Friday rolled along, and okay, I was there like an hour before, and I was nervous. I think for the first time that week, I was nervous. I was very nervous, and okay, so I'm a firm believer in dress to impress. We all say don't judge a book by its cover, but there's something about somebody that walks in a memorable outfit in an interview that just sticks with you. So I've sat in interview
look, I tell
panel.
people you need to be professional. Yeah.
Yeah. So for me, I've sat in an interview panel from the other side. And there's something about a candidate who comes in dressed well. You're like, wow, and then they open their mouth
Like
and they
you're a
speak.
psychologist already. You look like that lady in the hospital.
Yes, I was like her. It was the pencil skirt and the tucked in shirt. I was like her.
Yeah.
I was dressed like her.
It does have an impression. I agree with you.
It does, until you open your mouth and speak nonsense. Then it goes just like, after all this effort.
You need to make sure the dress matches your mind.
Careful. That's the challenge. So I went in, I got there was a lady sitting there who was twice as nervous as me. She was white. Okay, she was white, but she was white. She was just flushed.
Yeah.
And I now started having to, to just calm her down. And I think in the process of calming her down, I actually calmed myself down. Like, we here, they either want us, they don't, but just enjoy the experience. Eventually, she went in.
You are no longer the underdog who needs to be cancelled. Now you are the one cancelling others.
But the thing is, she looked like she's about to collapse.
Sure.
She was
And
not having anything.
At least you are now competing with 19 people.
Yes, for 8 positions.
But tell me now, before you get into what happened, what do you think made you that anxious on that day?
I think having gone this far when I didn't expect it to, and the fact that this is now literally about me. They're here to ask me about me, and I don't know what to say about me or what they want to hear about me that would be the correct thing to say. So all other activities were not based on me. Yes, the one-on-one interview to some degree, but again, it seemed a lot more like my career aspirations than anything else. Now they were going to sit with my autobiography. They were going to look at my dirty laundry, for lack of a better word. So there definitely was that part of it that made me that nervous.
But they did inform you what would be the focus of the session?
No, I figured
from other student.
Based on what had gone on that week and the fact that my autobiography had not been opened or my research, for me, by deduction, that was what was left to ask about.
Okay. Okay, so you get invited.
So I go in, and I was in two minds about wearing the heels, because heels will disappoint you when you're nervous. So I was like, you know what, I'm gonna wear the heels. So I went in. They called me in, and I got there. I stand, so I don't sit unless you tell me, you invite me to sit down. I will not sit. So I stood, and there is now a room full of 14 people who are just looking at me standing.
14.
14.
Sure.
14.
Okay.
So one of the doctors and lecturers then is like, are you okay? Would you like some water? So I'm like, I'm not okay, and water's not gonna help, because it wasn't going to help. The whole room was laughing. I'm like, I'm not sure. That was not an intentional joke on my end, but I was hoping he'd offer something else besides water. He'd go down the line, like whiskey maybe. But then he was like, okay, have a seat. I sat down, and he didn't introduce the panel. He just explained that I will be asked a series of questions, and they will go in whatever order they want to go in, and I must answer those questions. And he eventually did bring the water, and he pointed me to a box of tissue that clearly seemed like it was used by the other candidate, which I was told, do not cry in the final interview. So then I sat down, and what was the first question they asked me? I don't remember the first question they asked me. I forgot the first question they asked me, but it was, they fired the questions. That's all. That's the one memorable part about it. They fired the questions left, right, and center. They asked the switch from radiography to psychology. Here was the first question. They asked, how has psychology changed my life, or what about the career of psychology? But it had to do with the impact of psychology in my life. And I pretty much told them I explained to them how the perspective of psychology enlightened me in terms of myself, the layers of myself I've gotten to know in literally the past 2 years, and why I am the way I am, why I behave the way I behave, and why people receive me in a certain way. And I even made an example that when I worked in hospital, I'm Xhosa. As much as my surname is Zulu, I'm Xhosa. So there's definitely inherited traits about Xhosa tradition and customs and behaviors that Zulus don't appreciate. And one of them is a straightforward woman that speaks her mind. And my choice of words on being heard by a Zulu man don't always sound respectful, even though in my capacity those are perfectly acceptable. So I expressed all of those things that now I'm aware of, because for the longest time, when people didn't know me, they thought I was rude, and I never understood. People would for a good 3 months in a new job, people did not like me. People thought I was rude. And 6 months down the line, people do a 360 turn, and they are friendly with me. They appreciate working with me. And I never understood why this was. But apparently I sound aggressive. The Xhosa voice sounds aggressive. There's a lot of things. So, so I explained all of that, how psychology has helped me to be aware of that, to be intentional and all of that.
Wow.
They asked a lot of questions. They went to the research. They asked about, they brought up my family history and said, in the face of all of this, they've seen candidates walking here nervous, and some of them even crying. Why am I so confident? I'm like, this is not the time for tears. I said, there's a time for tears. This is not it. We've got the time. It's coming. But this is not, there's a time and place for everything. So, yes.
Yeah, no, I think you really stood out. It's not time for tears.
wasn't the time for tears. So I said, listen, I'm working overtime inside to hold back the nerves, because at the end of the day, I do not need to sabotage myself by being overly nervous. And, so that, and then they asked me about the application, the importance of context in terms of psychopathology. And I now know they wanted maybe me to look at that theory about etiology. So I think they wanted that application, but I didn't go in that direction. I went in this direction. So I told them about how certain behaviors in a certain context are acceptable, but when you remove it from that context and put it in a different one, it becomes pathological. So I said that's what context, to some degree, how it informs pathology, or sometimes encourages it, or sometimes it fosters pathology. So I explained it in that. I didn't go with a theory. And then they asked me about a theory I would apply to myself. They asked me about my role in the family, and I picked, because I'm married, I picked a marital family. My marital family, I explained my role in that family. And then they asked why I didn't talk about my role in my own family where I grew up, like with my siblings and all of that. I expressed again why, and I gave them the details, and also expressed that I don't think I've actually established myself in that role, because it was very toxic and there was a need to just survive in whatever was going on at that time, and the loss and the pain that was going there. There was no time to really establish what you are and what role you play in all of this. And by the time I got out, this is where I had found footing to establish myself. And then obviously they
very good answers. I will be scoring you high here.
And then they also asked me, because I spoke up, they asked me to reflect on the week. I reflected on the week. They then said they can see I've done a master's. They can also pick up, because I expressed my passion for research. They said, why research psychology? Why not research psychology? That came up again, which I expected that to come. And I said, I am not of the schooling that people who love research should not be clinicians. If anything, we should be looking to welcome people who love research within the clinical context, because there is a need to do research within the clinical context by clinicians. If there wasn't, you would not be putting an emphasis on research within your clinical program. So the removal of one from the other makes no sense to me.
Wow.
So
you said it that way.
Of course I did.
I want to put myself on the panel. Look, I think there's something appealing about somebody who's very honest in their approach, and they're speaking their mind and they're critical, but they're also factual. I think the key will be the factual. It's one thing to be, to be fixated in your thoughts and your views, but you are not factual. So I think what you are presenting was factual. What you just said now is very factual. And I think to present it with such confidence, it did, to some extent, I believe it made an impact on them as well, to still consider you. Because I think at the end of the day, we don't like, there's that heterogeneity that they want in psychology, And I think the minute you bring that, strong-headed persona as you present yourself, but you are very factual in your presentation. You're not just speaking for the sake of speaking. There's this arrogance that is bad in it. Because it's not factual, So I will believe it really, really made an impact, because by me listening to you, I could hear that this could also contribute a lot in a master's class.
Yeah, I know. I did also bring up to some degree, I think within my individual interview, that part, let's say you're picking up an arrogance or a certain persona. I spoke about that being my weakness, that I bring an unexpected masculine energy.
Arrogant. I think you are a very strong-willed person.
Yes.
And I think you also mentioned that it relates with your cultural background as well, being a Xhosa woman, and how it was also perceived within a work environment. And I usually say, I think personality traits are neither bad or good. They've got both. It's just a matter how you present them in different contexts.
Yeah.
So yeah, and I think what I'm pointing out though is that although it is there and it has a potential to be perceived wrongly, but the way you presented it, I think it could have easily been appreciated, even though somebody might be taken aback about it. Like you entering the room saying, "Oh, I'm nervous, but water won't help." I mean, it's like saying, this lady, I'm trying to help her. She's, you know, but I think somebody might also, find a joke in it to say, so that's what I'm saying. It's not, yeah, I usually take it there. I mean, personality is rooted in a temperament, and temperament is the way you are by nature. It's your inclination. You can't change them, but you can adapt them to a particular context.
Which I've learned through psychology. And another thing, I grew up with boys, so no mother in the house killed. So there's definitely a lot more need to be the aggression is something that was normal, and again, closer people. So so through I mentioned that to them, that I am aware of the energy I bring and its potential to intimidate a patient or a colleague. So I do try to tame it down a bit. So I am aware of it now, thank goodness.
Yeah.
Yeah, so I answered that. So that was another one they asked me that I felt was unique to me. And then again, the confidence thing, I think it was asked twice or three times. So like you're saying, they did pick up on that, and they kept asking, with everything and the situation that you're in and what you have written about yourself and your experiences, where is the confidence coming from? Why are you not nervous? I eventually got to a point, I'm like, am I supposed to be nervous? Is this environment not just for me to enjoy and embrace everything that's going here? Should I be spoiling this with nerves? And so they could pick up there was confidence, and there was a lot of it, to a point where maybe it did take them a bit aback, because they asked me 2 times or 3 times about why are you so confident? Why are you so confident?
Is that why they are 19? They are 14. Are they there to make you to be
nervous? I but so they asked that, and then there's the infamous, okay, a lot of questions went on, and I do think we had 30 minutes. It was supposed to be 30 minutes. Mine went over a bit, because like it was one after the other with questions. There'll be a follow-up question to that one and that one and that one and that one. And to a point where you're not too sure whether did I not give enough, or did I give them too much information to now ask this and that and that, but it was what it was. I got to a point where, because they gave us a swinging chair, when I tell you I was having fun, I would swing in the direction of the question. I'm like, wow. I was like, I got to a point where I'm like, this is about me. These people want to know me, and I think the nerves, I'm like, if there's one thing I know, it's like, it's this person. There may be layers to me, but I've definitely gotten a grasp of myself. And then the one question that they will always ask, and I told them when they asked me, I said, I expected this question. They asked the question about, we've got 20 candidates that want the spot. Why you? There's the why you question. And I told them, I expected this question. I've been to enough interviews in my life, and it's a question that was bound to come through. And I've been going through this the whole week, and so I gave them an answer that it was rehearsed to some degree, because I knew what they were going to ask. And when I gave it to them, when you can see even someone who wasn't paying attention now looks up to pay attention. So they asked me, so I explained, I'll actually give you the answer. They asked, so why you? We've got 20 other candidates. They want this spot. What makes you special? What makes you unique? I said to them, listen, I expected this question. This interview would not have been complete without this question. It's the ending of all interviews. This question comes through. I've been around the block. So
you really, this candidate is special.
What I not have said that?
No, look, that's what I'm saying. I'm not into. Yeah, I wouldn't necessarily tell people what to say, what not to say. I don't think it was a better. I think it's your personality. I mean, from this interview, I think I've picked certain aspect about your personality, which anybody, remember, psychologists, we are experts of human behavior. Anybody who knows you or have observed you from the panel will have already at this point, from the water question, have picked your personality. So anything that you say is going to be perceived, at least by a good psychologist, from the perspective of your personality. Because remember, when you become a candidate, your personality, I tell people, is who you are. If that's you say it's a male, or like you are, that's your nature, that's your inclination. You just sort of adapt it to the context, but it doesn't disappear. You get my point. Yeah, so I don't take that as a bad answer, but I think the preamble is centered around your personality, which, like, your personality. So you get my point. Yeah, so if anybody should be able to view personality like that. Yeah, so I don't think there's anything wrong in that context.
Okay.
I think somebody can say it and it can be wrong thing to do because it's not aligned to their personality and perceived in a wrong way or in a bad way because there's no alignment. But with you, I think there is that alignment.
So then I then went on and told them that I expected.
But even if it was wrong, it doesn't matter. You are selected anyway.
It's out there. It's in the world. So I then said, what in essence you're asking me is, what am I bringing to the table? What do I have to offer? Yeah. And I could see, like you're saying, yeah, they all nodded, like, what are you bringing? And there was another professor on this side who would just look up once in a while, and he still carried on, very, very disinterested looking fella. I said, I bring nothing to the table. I said, in fact, I bring the table. I told them, I said, I bring this table, this one here. I bring this table here. And I paused at this moment, and I could see even the disinterested one wanted to sit. Did she just say she brings nothing? I said, I bring nothing to the table. I bring the table itself, this one, just in case they would thought I was going to look for it outside. They need to know I bring this table. So I was like, I bring this table, and I expect you to bring something to this table. So I expect you to bring your own perspectives, your experiences to mold me into a psychologist. I want to bring clinicians and researchers to work towards interventions that are centered around patient care. So I said all the things that I want on this table that I bring. And then I said, the only thing I ask is that you give me a chair, not to sit on the table, but to stand on the table, because I want a girl sitting in Tembisa, Kayeli Chakukuletu, to see a Black psychologist and what they can be and all they can be. So that is what I bring to the table.
Wow.
And they all stared at me at this stage. And that moment of silence, and you're not sure. So because I clean out told them it's rehearsed because I knew you were going to ask. So I had to know what to bring. And having thought, and that was an honest truth, I am a student. What should I be bringing? I've got nothing to bring. You should be bringing. You are in the position to give me something. In an interview for a job, yes, I may bring something. But for a learning opportunity, I must bring nothing. I said I could say I'm bringing an open mind, but I'm sure the two people before me told you they're bringing an open mind. There's nothing. I said that the other candidates probably are bringing the open mind and the curiosity to learn. I can tell you that. But the honest truth is I've got nothing. After that.
Well, I didn't see that direction coming.
Well, it came, they got it. And then another one.
I didn't even expect that that response. But very interesting. I can imagine for them how it was. I think it's one of those where when you get there, you need to just ask How did you receive that answer from?
I do not want to relive that interview at all.
It will be an interesting to hear their feedback.
I did. Maybe it would be.
Yeah. Look, I think, you know what? I do think there's value in being honest, and I rather be judged for being who I am, but I also don't become who I am to my detriment. In other words, I like what you said before. I had prepared this, which means in your process of preparation, you have already weighed the cost of the response you are going to give. And I think people need to do that, because I have been in interviews myself also where I feel, I was telling my wife the other day some of the things I will say in the interview. If it is what it is, because even when you take me, you're going to get that. So if I don't introduce you to myself now, I don't want you to be surprised after you selected me that this is how I do things. So I think there's that element as well to certain personas, that you need to give people a bit of yourself, but within the confines of the context.
Yes.
And see how they handle it. And I think it relates with what you said when you told your husband that if you don't get selected, you'll be happy because they don't want you, because you gave them you within the confines of a selection context, and they don't want you. Then I'm fine with that. Why should I give them somebody whom I'm not, and they select that person and they get me, and they're like, oh, we thought you are, that fake person we met in the selection. So yeah, I'm listening to you in that context, and I hope those who are listening take that as well, and present that, and see how it goes. I think sometimes when you get feedback, the feedback can help you to understand this profession is not good for me, or I'm not a good fit for it, and we leave each other.
Yes.
Than to keep on pretending until you realize that both of you don't match.
Yes. Yes.
Yeah, please go on.
So after that, there was obviously another very predictable question that comes. I'm a wife, I'm a mother. They pointed that out, and the ages of my kids being very young. They asked, how do you intend to navigate that situation? I then, again, like I said, I'm practical. I said, we live in a world of technology. There's WhatsApp calls, there's video calls. So mommy not being around is not like it used to be in the olden days, where you only see her when she eventually comes back home by train. So I can see my kids on an ongoing basis via video call. Flights between Joburg and Durban are reasonably cheap when you book in advance. So there's definitely a lot of practical means my kids will have access to me. And there's also the upside that what I'm doing is also, as much as it's personal, it also does something for them, because it will definitely, it will inspire them to understand, just because you're a married woman with kids, it doesn't necessarily mean you should not have career aspirations, especially when you've got a supportive husband or a family. And, I then also explained, like, I'm married into a very supportive family, so my mother-in-law is very involved.
You mean extended family? Wow.
Yes, so they're very supportive. My sister is supportive, and I don't need to be home for everything. I've got a supportive, it takes a village to raise a child, and the village is at my house. And
yeah, so I like that, because I think what you have done, and I think I covered that in the Q&A book, the video, where I speak about, they will ask you about your support structure, but ask it indirectly. And I'm glad that you picked that in this question and brought that, without them asking directly about your support structure.
Yes. So after that, then one lady asked another question and said, we've all listened to you speak. You speak very well. My question is, why should we give you a chair to the table as a psychologist and not a motivational speaker. And
Okay.
and I guess I was taken aback at this stage. That's okay. I said, if
Am I here the motivational speaker or a psychologist?
yes, I think they were like, the wrong career, this one. But I will not, I was taken aback that they picked it up. At SACAP, I've had a lecturer also comment on similar lines, that why are you not in this part? Same thing happened in radiography undergrad. I had another lecturer who was like, I don't get why you're in radiography and not in this path, you know? But I'm a Black child. Entertainment is not a career. You know, it is now, but it wasn't for my parents and therefore not for us. So, you know, when you get questioned in lines of that, so they asked that, I said, for me, I said, firstly, I'm going to take this as a compliment that you feel I speak to a point where I motivate you. So maybe we can look at the fact that I have motivated you in my cause, and you should maybe then just join me in my cause to try and change the perception of healthcare workers towards mental health and, you know, and patient care. So if I speak well and I'm motivational, that means ndiya Bluetooth. I actually said that. I said that means ndiya Bluetooth. So join me, you know, be motivated and get on board. So then after that, I then said, the reason I cannot solely join as a motivational speaker, if that were the available position, is because I'm a firm believer in be the change you want to see. So I've got a hands-on approach. So if I want this to be done, I need to be part of the team that gets it done. So I cannot sit here and motivate people about patient care and tell people about the importance of patient care, but I'm not actively participating in that patient care. And as a qualified radiographer, this is the quest I'm coming for, to motivate non-social science healthcare workers to be mindful about patient care. And the only way I can do that is by being a bridge between these two gaps. So you've got your social science and you've got your natural science, and we seem not to meet, because social science is focused on quality, while natural science is focused on quantity of life. But these two do not exist without the other. And I'm here to be the bridge that creates this coexistence. And I am passionate about it because it's coming from my heart and there's nothing I can do. I speak like this because I love it, I want it, and I want it to happen, and I want to be part of it.
Yeah, I like that. And I think what I wanted to comment on was, I think sometimes when there's too much passion towards a particular thing, there's that advocacy. To some might look like a motivational speaking, so to say. You get a point, but because you advocate for it to an extent where somebody listening will be motivated and think maybe you should be. It's like when we grow up, they talk a lot, they say be a lawyer. You know, as if law, you just talk without, you know, but now that you are saying it, I think it makes sense to me. And I could, in a way, sort of just picture, you know, the future of it, where you advocate for psychology, the career, and the role it can do in the life of people, and encouraging also to follow. Because, you know, when we are speaking now, I'm putting the Anelisa in front of me and the one on Anelisa Zulu on Facebook. The one on Facebook, I could also see the passion, the knowledge, the eager to help, you know, and I think that's where the passion will eventually manifest. Time will tell.
Time will tell.
Yeah, time will tell, but I think it's coming. Yeah, it's coming. One day you'll be Anelisa on YouTube speaking about psychology. You'll never know.
Social media, thank you.
You're already active on social media. You are the most highest contributor on Facebook.
It's wrong. There's anonymity.
Yeah, you're already active. Yeah, but anyway, continue. But I like that. I think it's a good thing. We need people like that, and we need not to suppress them. That is why psychology, there's lack of knowledge, lack of information, because people see it as a motivational speaking. Social media is the worst. Academics don't like it. I was at a conference, I hear how they speak about it. Now I want to start writing papers about social media just to educate them. Just bring a new world, because we speak all these academic boring things. Now I want to bring social media to conferences. Anyway, continue.
So yeah, that I think that was their last question, and then they said thank you. And I was previously told you're allowed to ask questions, but I don't think they said we went over the time, so bye. So I went by. I left. And I took the water with me, of course, because it was offered to me at the end. I took both bottles too, not just one. I took both. I left. And then I left, and then on Tuesday, I got a letter that said they've offered me a place, and I could not believe.
Wow.
Believe. One shot.
Wow. Yeah, I think after all that, it comes down to that letter.
It
And
does.
so when it came, where were you?
I was at home doing schoolwork, catching up on schoolwork. So I was at home.
Because you are behind after all this time.
Yes, I wasn't far behind, but I was quite behind. So I was catching up on what happened in class and all of that. And then the email came through. And thank goodness they've got a subject line that they use. They know how to use a subject line. You know, it tells you the subject there, what's in the letter here.
Wow.
Like, except offer for 2022. I was like, say less.
Wow. No, congratulations. I think, it's a huge achievement, especially for a first-time applicant. It's a huge achievement.
Yes.
Wow. I'm sure you have called that psychologist who inspired you for the seed they've planted.
I tried. Long story.
But nonetheless, congratulations. I think it's a huge achievement. I think after applying to every university, getting only 2 invites, and this one in particular, you are not even supposed to be there.
Oh, I was an intruder.
It's because somebody dropped out and they're like, oh, let's just invite this underdog and see what she can offer. From being an underdog on the first day where everybody's encouraging you, just take notes, don't be discouraged, and you become one of the candidates for 2024. Congratulations, said you, Jay Nohan.
Wow. Yes.
Your funder must have been very proud of you.
My funder has his other agendas, but yeah, I think he was pleasantly surprised, because based on obviously all the work that we've heard about psychology, the whatnot, there was definitely no expectations that I could go for one interview and get in. There is that fundamental understanding that there is a need to learn in the experience and be able to reflect on one's mistakes and one's, performance in order to improve. Hence, we went in saying, I'm there to practice for Potchefstroom.
Wow. And I want to get into now. Yes, what happened with the Potchefstroom one?
I immediately, after reading my letter 3 times and screen grabbing,
to make sure that you are reading it accurately.
I didn't read this wrong. I sent them an email and expressed to them that I've been selected at a different institution and I can no longer honor my acceptance to come for the selection, and thanked them for it. And they congratulated me and said they will invite another candidate.
Wow. Now you appreciate what rejection of a space means, because you are there because of it.
Yes.
Wow.
Yes. I appreciate it more than most. I do.
Wow. No, I'm so excited for you. And yeah, congratulations, man. It's a huge achievement, I'm telling you. I mean, I was interviewing somebody. I just posted this video this past week. Similar story in a sense that it's a first-time applications and it got accepted. To say there's an element of frustration that you guys have been spared of, you know? And I wonder if you ever sit and think to say, you know, there's certain frustration I will never know about because I've never been rejected. And there are people like that at this point who have and like your husband who believe psychology don't get in on the first try. You need to at least several times. What can you say to those people who are out there and feel it's never a first time entry? So you're not going there to be selected. And that I think can affect people mentally. What can you say to those people, particularly those who are still yet to come for the selection? Others didn't apply because of an advice that they must wait for a year, take a gap year, go volunteer. And imagine after working for so many years, they tell you to go volunteer. So, so what can we say to those people? Because I want, I want people to engage with knowledge reflectively and critically. Because hearing something from a knowledgeable person doesn't mean everything must be accepted. Even these theories, I mean, we argue with Freud, we disagree with Freud,
Yes.
Piaget, all these theories, we argue with them. That's critical reasoning or engagement with contents. But I get a sense psychology students, they just take it and run with it, just do it. What can you say to those people, particularly those who are yet to come for selection for the first time, and there's a lot of information about it can't happen? It can't happen. It doesn't happen like that. Go take notes and come back.
Wow, what can I say? I don't know what I can say.
You are here. You are here.
But I think, like you're saying, it all starts with you being able to engage with yourself mentally and put yourself in a position where, one, do not compete. I think they say this all the time, that don't go there competing. And the very first thing most people ask when they get an offer and what I've seen anyway, is how many people are invited. And I've never understood the relevance of, and people like, no, I want to know what are my chances and whatnot. And I think that immediately puts you in a spot where you are trying to count your chances of getting in and not just maybe looking forward to the experience of being there yourself. So for me, that the fact that there were 80 of us or 100 of us or even 3 of us meant very little to nothing to me. So if I wasn't selected, it wouldn't matter then that 72 of us are not selected. It doesn't matter. I'm still not selected. And if I am selected, it still doesn't matter that there's 6 of us selected or there's 70. Where you sit in a statistic, it's about you. What's happening on the other side becomes irrelevant. It's how you deal with the situation again. So I think maybe firstly, just taking out that whole thing of going there with the competition mentality and just go there to be the best you in that experience, come out of there a better you, because they keep saying this reflection. Yeah, they talk about reflection. They want someone reflective. They want someone. I think what they're saying there is your ability to just learn on the go. You're not prepared for something, but you have been in a similar situation before. Use that, apply this to here. So like with me, with the role play, I had been in a similar situation where this patient of mine was saying. So I was able to use that to reflect on my moment and my thinking and what I probably would have wanted, and then maybe started engaging her from that capacity. So there's definitely a need for people to learn to be reflective and be themselves. And again, be yourself. I think I asked a lady who was selected in WITS, who was another lady who was helping me. So there's a guy, I forgot his name, and Ntombi, she's from WITS. She's going into the WITS class next year. The two of them, here and another one who said SMU is a gentleman. When I tell you, I would talk to them and they would walk me through this and understand that there are people that are just willing to help you for free. You know, this a lady I offered to help, and when I tell you, she was so suspicious. You know, she was so suspicious. I think she was actually going to Porsche. We met because we're both gonna go to Porsche. So when I got into UJ, I said, I'm going to UJ. I've been selected as UJ, so I'm no longer coming to Porsche. But based on the activities that are happening in Porsche, I feel I could help you. After a few times of trying to help her, I realized she maybe doesn't trust me because I was the one running up. People are willing to help. When somebody gives you help, take it. It does, even if they're going to the same selection as you, the experience will never be the same. There's a need to be familiar with being asked certain questions, with being nervous, with all of these feelings that happen when you're there. The more you are familiar with being nervous and the more you are being put in the spot, the better you are able to handle the nerves. So I was able to handle my nerves in the final panel because I had been so many times in that similar. I've been to, I don't know how many job interviews. So I was able to reflect back on, I have felt this way before, and I did not die. I did not topple over. They did not beat me. They did not think any less of me. So neither will these people. So reflecting on past situations and being familiar with the feelings of being on the spot helps. And that only happens if you let people help you, if you ask people to help you, and maybe extend a bit of trust. There's also another one. When I tell you, I think she was going to PE, the recent selections. So I think the other reason I feel this is an important thing is because these two that helped me from WITS, one from WITS and the SMU one. When I tell you this guy asked me questions about my autobiography, I told him, and he started asking me questions. I told a complete stranger about my dirty family history. He had nothing to gain from helping me, and I had nothing to lose from asking him to help me. He could have gone and told another candidate about my story of meeting a psychologist, but nobody's going to tell that story like me because they were not there. It's my story. But having told him that story, he was able to say, you know what, Lisa, maybe emphasize this part of the story, or maybe emphasize that part of the story. So I was able to get pointers. So there's a need to rehearse. I know you cannot practice what's going to be done. It's different every year, but rehearsing gets you used to the feelings of being nervous, to the feelings of being on the spot, and ask people. People will help. These people that will help. Like I'm doing my honors research collect. I've got a lady who immediately I posted, they inboxed me like, I'll answer, I'll participate. And when I said thank you at the end of the interview, she said, the only thing you can do to thank me is help somebody else. So there are people who have been sent to help other people because now I've been tasked to help someone else. She said, if you see someone and you fit the criteria, go for the interview. You know, so we are tasking ourselves when we've been selected to help. You are sitting here and you are tasking yourself with informing people. Research. You're giving us the generic, the questions like I told you, you've got them in your Q&A. You are not saying go rehearse your answers, but go be practical about the answers. So research for me was the winning formula. I researched being in the situation by being in the situation. There's in psychology, what is the thing? Exposure. You know, when they treat PTSD, they say exposure. That's it. Exposure is definitely going to get us there. It definitely got me there. I role played 4 times before the role play day. I role played over the phone with my cousin. I role played with my husband. Role played to a point where, you know, you get to a point you're like, I know this. And by the time that lady walked in and that immediate fear that comes in of what if I don't know, I immediately said, I've done this before. I don't need to know. She will tell me, you know. So for me, what would I want them to know? Practice those situations, practice those scenarios, practice those interviews with a friend, with a colleague, with a lady from Checkers, anybody. They don't need to have a psychological background for you to tell them about yourself. And when you've said something out loud, you're able to also self-correct about, I can actually say it this way. Two, do your research. The context, the content is out there. It's being put out by channels like this one. Other people are putting it out. Like even SACAP, I saw it on your channel. I saw someone comment on SACAP. I inboxed them. They told me all I needed to know about SACAP. There's people commenting who have information. Sometimes it's accurate, sometimes it's not, but it's information nonetheless. You take it, you go vet it. You know, so ask people, and for me, that's basically what I feel really gave me an upper hand. And again, be yourself. They were looking for me this year. Next year, I could have gone next year and did exactly what I did, what I'm going to do, what I did this year, and not made it through. So they're not looking for me next year. They were not looking for me last year. They're probably looking for the next person watching this video, but not unless you go there and be yourself. You can't go there and be Anelisa. They found me already. So go and be you. And if they're looking for you, they will take you. If they are not, be content that the following year they are looking for you. But go back and research where you feel you could have done better. Like I'm saying, when I was not getting called, I immediately started reviewing my applications to see what could I add here? What did I say nice? You know, if you feel you were on point and you've delivered the best you, then they were not looking for you. Next year they are. And the other thing you said, maybe you and psychology are not a fit. Is there somebody else that's better suited to you? And find that person.
I like that if they're not looking for you this year, they won't select you. But if they are, they will. But even if they're not, you go prepare yourself. Maybe next year they'll be looking for you.
They will.
And while you were talking, actually, and you were emphasizing the fact that you be yourself, you go there. And most people, they tell me that they were themselves, they were not selected. If you were to reflect and think back and look at the responses that you gave, and what do you say is the most crucial aspect about the selection process that perhaps helped you to be selected? Because you said something very important about the last panel, that you told them that everybody could have came here and told you about their bring an open mind, which you are not going to say because everybody say it, which is true. Selection, we more or less speak the same language, you know. And I was telling somebody that because also the popularity of our channel, everybody listen to our channel. So more or less everybody has prepared the same because you have watched the same video. So my question then is, what is it then that make, and I'm asking you this because you have been in many job interviews. This is just one of those interviews, although different. What do you think, in your view, when you look back to say, I think this is the core, I think this is the most important thing about selection? It doesn't have to be one, but what are those things that you think somebody needs to look into, you know? I think with my experience, I think answers, they are one aspect, but how an answer is given is another. You know, you can give the same answer, but you are giving them differently. You package them differently. It's like a gift. You know, somebody can give you a nice gift, but the packaging can determine how the gift is. You get up, but just on your side, and I know I'm just speaking with analogies and all that somebody might not even make sense, but your view, what do you think that thing or those things are?
Being memorable. We could
Okay.
point out that the sky is blue, but like you are saying, be impactful and be memorable. There's just something about a candidate that we all remember. You know, be impactful and be intentional about being impactful. Like, I'll take an interview in government. It's set questions, it's set answers. we all come in. I remember at some stage we all asked Bantu Pile principles. I think this was across all professions. You'd be asked the Bantu Pile principles, conflict resolution, you know, and they standard answers to these questions, and they're all sitting there looking to tick. They've said this, they've said this, they've said that. But it is how you say it that makes them all remember to say, yay, they said it, but do you remember Ubani? You know, there's something about being memorable. I told them that I was open-minded, but I didn't. You know, I said I could come here and tell you that I'm open-minded. That's exactly what I did. I told them that I'm open-minded, but my delivery of I'm open-minded was different from you that says I bring an open mind. So what? You know, but you know, so being memorable about how you deliver the same answer that your colleague is going to deliver is for me, I think, definitely somewhere where you one has an opportunity to stand out. They've got 80 candidates, or at the final panel, they've got 20 candidates who've all said they've got an open mind. But I came in and said, I'm not going to tell you I have an open mind, because I need to be sitting here because I have an open mind, a curiosity to learn. I am pointing out what I have, but I'm not telling them that's what I want to point out, you know? So there was you indirectly get them to a point, but without getting them the same way other people are doing it. So you need to be memorable. You need to make an impact. You need, as much as somebody might look at my confidence, I've intentionally made it a point when I walk in the room, I must have walked in the room, and you must all know I walked into that room. It doesn't matter what's happening at that room, but if I walk into a room, you will know that Lisa walked into that room. I've said nothing because I'm intentional, I'm impactful. For my role playing, I wore a red dress. When I tell you 3 of the students commented on that red dress when I was in the final panel, they all remembered me. They said, oh my God, you're the lady that was wearing the beautiful red dress. It starts with the way you dress. You know, when you open your mouth, be intentional, understand that people, what they see first and what they hear from you is going to stick in them, and you want to make the best of that moment. So walking in and standing instead of just taking for granted that I should sit, gave them all their time to just look at me. They had to take this all in, and I gave them that moment to take it in. I know it sounds silly, but I used to do modeling. Some things you pick up about the need to walk in a certain way, and when you open your mouth and what you say and how you say it, and I guess like there's a need also, that thin line between arrogance and actually delivering facts needs to be, you know, you need to be able to back it up. You've got to be able to back it up.
No, you're right. Yeah. There's one lady, she's an EDHE EP at SMU. I've interviewed her at some point, I think last year. She said at UP, she was selected there. She said, I decided to wear a colorful dress. I didn't want them to forget me.
Yes.
I didn't want them to forget me. Yeah, look, I agree, because in a sense that, and I tell people this needs to be very intentional. But before we close, you mentioned that you saw our channel on a SACAP communication. Is that how you discovered us?
No, I saw, I think you were, what were you posting about
I would have
last year?
thought you have seen me on YouTube, on Facebook,
No,
on Facebook.
You were saying something about last year, one of the candidates you were interviewing, you were posting the link to that.
On Facebook.
Yes, on Facebook. And then I started linking and then watching videos from there. So I've seen enough of your comments and enough of your links, and sometimes there's a lot of things.
I've also seen a lot of your comments.
So I have, and I remember
you say you're not a social media person. I've seen a lot of you.
platforms. I definitely am there, but I'll send you a friend request. You'll see there's nonsense. I've got no content on my page. I've just got videos and things that have got nothing to do with me. So
So tell me, I'm sure you've been on our channel, eh? You have seen videos we have.
Yes.
If there one that you'll recommend to those watching that
I
comes into mind?
the gentleman you spoke about the three universities.
You saw that?
I saw that. Of course, I saw that.
But why did you have to watch it? You are selected now.
Yeah, but it's research. I'm not be here because there's a lot to learn, because I'm saying I want to help other people. So the more information I get, when somebody asks me about something, it's easy for me to actually reflect on other people's experiences and say, another one experienced X, Y, and Z, another one experienced that and that, because it's especially if someone's coming. So for me, if I can reflect on other people as well, to give to one person, I become a collective source of information. But obviously, you can go watch it yourself, but this is the gist of what this person was saying, and this is what I would find is an important takeaway to take from there. So yeah, I've watched that. I think the Q&A I've also watched. Was there a time you interviewed a radiographer? There's a time you interviewed a radiographer.
Yes.
So I did after that watch a lot from you. I definitely find a lot of your content to be useful, and
Thank you.
it also it seems to accommodate a lot more of a certain class that is not targeted by some content. Some content needs money, it needs this, and yours seem to look for the underdog. It gives the underdog a bit more hope to say this is done. And you are also very honest to say sometimes psychology is not for you. You're not sitting here and say, if you want psychology, go for psychology, but you are honest in what you give and what you bring, and your intentionality of why you do what you do. So yeah, I do enjoy a lot more of your content. I do.
Is there one you can recommend?
The gentleman with the 3 universities. He is my hero. The confidence of 3 universities, and that's it.
Yeah. Look, for some reason, I thought you watched that one. You know why? Because we spoke about, is it a month or two ago? And the day or few days after I posted that one, and I think my preview had to do with, I can't remember if it had to do with him applying, but I thought when you see this, because it speaks to you of few universities, you will remember that I'm still waiting for your feedback. Because immediately I got your message. Did it remind you that you are supposed to have an interview?
It also did. I was like, oh, but I was still, I've been, yay. The last term is just not, it's not forgiving for me. I can tell you that much.
Yeah. Wow. I can imagine. No, look, but I think, look, what you have shared is very informative. I've really learned a lot, and I know many will benefit from this. And I hope they use it as a guide, because not only have I heard you, but I also try to reflect and just clarify to them on how they should understand it, because I think that's the most important part. I think if anything from now on, my focus will be in delving much into explaining the intricacies of the selection process. Because I feel, I don't know. I tell people, people who come here, they pray. People who come here, they know our channel. So all of you, so there's no exclusivity. You all have the same content, the same advice. What will make you special? But I think people who go there, regurgitate our channel, might struggle. We want people who gonna go there and bring themselves into this knowledge. Use the knowledge to help themselves and apply yourself into this knowledge. So last words before we close, any person out there, you know them. Some of them were on your sitting on the couch with you, on the seat with you. They've not been selected, despondent, and are going to come back for the third time, fourth time. whatever number of times, I think the way I like you to reflect about it is that, I mean, you left masters in radiography. If I listen to you correctly, you did a diploma 2 years, you did a BTech 1 year, you did a master's for 2 years.
No, diploma is 3 years. So diploma was 3 years.
Or diploma's 3 years, BTech was 1 year.
BTech is part-time, so I finished it in 3 years.
So BTech was 6 years of studying.
And then
master's
took me another 3 years to finish.
So this is 9 years of study.
It looks
and
like
then you worked, and then you came back and added 1 year of Unisa, which is 10.
Yes.
1 year of SACAP, and now you are preparing for 2 years of 1 year masters and internship. For somebody, one quick fix of career. I mean, I was telling somebody that when we grew up, well, when we started varsity, I mean, I started at SMU, we used to, people could study BSc and do medicine and all that. Even now, I think, not that I don't want to study, I just feel I don't need anything academically, But if I needed to, I wouldn't mind going to study. But people want quick matric, what's the 6 months course that I can do, and make it. And what can you say to those people who really want to give up on their dream? And that's what I want you to reflect on. You went for it. Somebody could have said after 9 years, no, if you have not achieved it, you have not, just leave it, and prepare for raising family and, but you went for it even after 9 years of studying. Words of encouragement?
It's not a straight line. There's something we always say as children, you need to kiss a lot of frogs before you get your prince. It's pretty much that. So I went all the way to radiography and all the way around, literally short of almost, I was starting a PhD in radiography before I actually found my feet. So we are, it's not, we're not all gonna get there at the same time. And once you accept that and what it actually means practically for you, you will start enjoying the journey of getting to where you're going. So I went to radiography, I went around, and only now I'm sitting in a position where I'm saying, I have found my calling, I have found my career, and none of this experience would have been appreciated if I had not gone through where I went through. Maybe if I had gone straight to psychology, I would not have been selected at UJ at all, ever. So all experiences that happen and the times they happen contribute to where I am now. And I cannot diminish the value of those experiencing by saying it took me so long. And once you sit there with the title of whatever title you want, psychologist, doctor, whatever, nobody actually asks you how long it took you to get it. Your patient will sit across from you and receive your service. No one's ever asked me, how long did it take you to finish your diploma? And I finished it in the time I was supposed to. Once you get to where you're going, it doesn't matter where you've been, but to get to where you're going, you need to go through where you need to go through. And it's different for everyone. And this was my path. The next person's is different. The next person's is 5 cycles of selection. And then it is that. There's nothing you can do about it. You can't fast track it. There's definitely no quick fix. And it also helps to have a motivation that is intrinsic. We always speak about intrinsic motivation. And it goes, because once something is centered in you, it doesn't matter what happens around, you will always find your way back to it. My passion was patient care. And because that was what was centered in me about my life and about what I want to do, I always came straight back to it. And it is the same thing I sat across that panel and told them, this is what I want. And if it needs a clinical psychologist title, then I will go and get it through a clinical psychologist title. If it ends up with a PhD, that's by the way, but what I want is this, and it's intrinsic, it's in me, and it doesn't matter what else happens. I want what I want, and it's why I need it. And once it's centered in something that is of value, that also benefits other people, I feel that also helps. You know, when it's all about you, it tends to be very hard to translate that to other people. Psychology is a giving career. Your motivation needs to be in giving, not I like to help people. How, why, when, for what purpose? You know, that fulfillment that needs to come from helping people needs to be truly intrinsic, and it will not die because the situation is not permitting at that point.
Wow, 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 wow. I think that's the key to close. You have wrapped it up well. And I think there are a lot of takeaways from the video. And it's all up to a person, I think, at the end of the day, to determine how much they want it. How much they want it. And I like what you say when you say it's not about when you complete, nobody's gonna ever ask you how long did it take you. And I say the same about psychology. We don't write psychology from Limpopo University, from Rhodes, from Northwest, from UCT. So these people who say, me, I can only do mine in UCT. Me, I can only go there. Me, I can only go there. You are only limiting yourself. I like what you say. You applied for every university, even the one under the tree. But what shocks me is that only 2 invite. But that one worked out. Imagine if you left out these 2 universities. You see? So, Anelisa, thank you so much. I really appreciate your time, and I hope those who are on Facebook can find you, because I've seen your comments, very, very helpful. I must say, you are there, you give and you provide support. That's why I've got it's a hunch that one day you'll be on YouTube. One day it's one day. You are very close. The minute on Facebook, there's a very fun line. Yeah. But all the best with your completion of your studies this year. And all the best for next year at UJ. I can't wait to interview you again when you are finished and you are about to embark on your PhD and you are so excited. Now you are a psychologist. I can't wait. Anelisa, all the best. We'll talk all the best with everything, and enjoy the rest of the year, and looking forward to next year when you start, and all the best. I tell people we fight to get to psychology, we get there, we have no life, and we regret why you are here. But I don't think you will regret.
I'm looking forward to it. I am. Every bit of me is looking forward to it.